Yes, good morning. Good morning. Are you Peter Marogo somewhere?
Peter Marogo somewhere. Oh. But I hardly use the Samuel because it's my father. So most of the time I use Peter Marogo.
You are
officially Peter Marogo.
So Samuel is your father. And you don't want to, you normally don't want to use Samuel.
I hardly use it. Because now I have my own identity as an adult.
So you have forgotten your parent?
I have not forgotten. It's my official name.
Okay, so I think you should appreciate that, so that even your grandkids can know that you are their father.
Exactly.
Okay, before we proceed, you are supposed to take an oath or an affirmation. The officer next to you will guide you on how to do it.
Peter Morocco, do swear that the information I shall give before this committee on the matters under its consideration shall be the truth, the whole truth, nothing but the truth. So help me God.
I think you were informed that take a seat. You were informed that you are supposed to have come with testimonials, originals and certified copies. You have both?
Yes.
Kindly share them so that we can cross-check everything is in order. Okay. Certified copies are there.
Yes.
Yes. Wana Marogo. You said you prefer the name Marogo or Peter Marogo.
Peter Morocco.
Unfortunately,
I can use my
unfortunately, I'll add Samuel
yes.
because I'm also a father of a number of children, and I don't wish even when I die they should still use my name. So I'll still use the name Samuel because it is in your identity and in other documents. Would you mind to tell us about you so that at least we can understand about you, and even you can add on about before we move to that, allow me to introduce the committee members because you appear to be someone from within. Maybe I thought you know everyone.
I have met that.
Okay, let me make it formal introductions. I'm Teddy Mwambire, the chairman of the Committee on Appointments. And my vice is here, will introduce himself as a around.
Tani Kombo, Deputy Chairman of this committee.
Vice, you are the board.
Tani Kombo, Vice Chairman of this committee.
Thomas Weshengo, I represent the ward, the Milan leader, and I'm a member of this committee.
Sophia Abdullah Chacha, member of this committee.
Agnes Sidi, member of this committee.
Mheshimiwa Said Juma Idi, member of this committee. Theophilus Kalambi Shom, from Deputy Leader, member of this committee.
Mheshimiwa Koki, representing Marekani, Deputy Leader of Majority.
Give the other names, please. Don't give one name.
Oh, me.
You said Mheshimiwa Koki.
Oh, Martha Koki, Msyoki from Marekani, and Deputy Leader of Majority and member of this committee.
Mheshimiwa Toer Abdul Karim, Deputy Majority Whip, member of this committee.
Rabia Ali Omar, member of this committee.
Ibrahim Abdi Ahmad, Majority Leader, member of this committee.
Okay, let the staff also introduce themselves, starting with the clerk of the assembly.
Michael Gano, the clerk to the assembly.
William Katana, principal clerk.
Agnes Rukagua, clerk to the committee.
Dr. George Hansen, director.
Matangugi, principal marketing.
Omar Chumi, Chief Sanitary.
Gillian Gala, principal clerk assistant.
Charles Makinga, director.
Masekuria, and the
Harrison Kirambo, director HR and administration.
Rashid Leto, Principal Legal Counsel.
Damani Safari, public relations officer.
Rafael Renga, communications.
Irene Chepkemoi, communication officer.
We also have a friend to the committee, can introduce himself. Thank you very much. Welcome to the Committee on Appointments. We would wish you give a formal introduction, tell us about you, and probably the department of the proposed.
Thank you very much. My name, I hope I'm audible enough for everyone. My name is Peter Rogo Samuel. I was born in 1959 in a village in Danze division called Kafuloni. I started my first time nursery school in Kafuloni, but then I think on the by going the second time, my parents migrated to Ede, Jimba, where we settled, and I continued with my primary school at Ede Primary School. After completing Ede Primary School, I proceeded to New Era High School in Mombasa, where I did my Form 4, or Form 1 to Form 6. Then I joined the University of Nairobi, where I did a BA degree. And after that, I was employed as an information officer in the Ministry of Information, which I worked for, about 5 years. Then I joined an organization called African Medical and Research Foundation, AMREF. And within there now, I branched off from my original, career to health. From then, I started working in the health sector, and in 1990, I got a scholarship from the US government under the Training for Development Initiative to go and study my master's in the US, a master's in public health specializing in health systems management. Then when I came back, I continued my work at AMREF, and in 1994 I moved from AMREF and joined Family Planning Association of Kenya. Then, now it has changed its name to Family Health Action Kenya, where I worked for about 8 years, again managing programs in the health sector, particularly focusing on reproductive health. From then I joined Family Health International in 1989, where I progressed now from being a regional program officer in charge of a number of countries in Africa, Senegal, Zimbabwe, Ethiopia, Tanzania. I worked in those countries for quite a while. And over the years, I got promoted to Deputy Director of the organization. And finally, over the years again, I got promoted to the Country Director, which I did for 26 years as the Country Director for FHL 360. Then the organization again changed its name to FHL 360, which I worked in the health sector. Throughout my career, particularly in the health sector, I've worked with several counties, then provinces, then districts, and now counties. So I supported quite a number of counties in terms of health programs. Notably, for example, through the support that I was providing to the counties, the first HIV care and treatment site that was established in Kenya was through the support that we provided as an organization. Because when that opportunity came with the funding from the US, my first port of call was really to make sure that it goes home. So we started the first care and treatment site in Kenya at Coast General Hospital. It became the learning site for all the rest of the country, and from then we rolled out with the support of government, getting support from other development partners to to roll out throughout the country. And Kilifi was one of those beneficiaries. I've worked with Kilifi County, I've worked with Kwale County, I've worked with Lamu, Tana River, Travasi, all that supporting programs in the health sector. So I did that work until 2019, when my contract came to an end and decided to take a break. Since then, I've been in consulting, sometimes you're never let go, you're asked, come and help us here. So I've been consulting for quite a number of organizations in the health sector again. So I've been doing quite a bit of work in supporting programs in several counties, like the whole of last year. I mean, during the COVID, of course, things went down, but most part of last year I was working with the Global Fund and AMREF to review the TB programs countrywide, which we completed at the end of last year. This year, working with Save the Children to look at their maternal and child health programs, redesigning their programs to support the government of Kenya. So to date, I would say that that is me, and I was nominated to support the department, to head the Department of Health and Sanitation in Kilifi County, which is really something I'm proud of, and the fact that I will be able to lend the experiences that I have gathered over the years to focus on the health and sanitation in Kilifi County, which is why I'm here to make this one.
Thank you very much, Mr. Maro. But there's something very important that maybe the committee is not aware of. Not talk anything about your family. Do you have a family?
Yes, I am married with one wife, with 3 children, girls. One is married, and the 2, and they're all working. So, essentially at home, it's just myself and wife at this particular point in time.
So you've basically been working on the preventive measures or creative?
Both. I have experience in both clinical, supporting the establishment of clinics, strengthening quality of care in clinical services, and the prevention side of things. But as you know, you may be aware, there has been not much investment on the preventive side, and that is really the unfortunate thing. So a lot of the investment have gone to clinical care settings, which is good because we need to do the curative, but critical is we need to put a lot of investment in preventing people from getting to the level where they need the clinical care.
What is your net worth?
Approximately 139 million to date. And that comprised of 3 houses that I have in Nairobi, and some investment that I've made with an investment fund title. It's really in limbo right now, in trouble, but we hope that will be resolved soon, so that and a vehicle which I own, which I use for my. So cumulatively, that's essentially what it is, and comprising of a lot of that comes out of the earnings that I've had over the years work, and a lot of in the NGO sector we don't have what we call pension, we have what we call gratuity. So out of that, those are resources that we're able to invest in the properties that I've just mentioned.
Oh, that's great. You have informed the committee that you have wide experience in consultants.
Yes.
Are you closer to your questionnaire? The questionnaire you provided the assembly?
Yes.
You have a copy of it? Kindly, let's go to 19. Number 19 of the questionnaire. Page 4. Page 4. 4 of 8.
Yes.
Look at B.
Yes.
Is that the case?
Yes.
This is the case.
Yes.
So you are consulting, but you have never done anything. You have not never written anything to, as a policy, maybe to either of your clients.
My consultancy has been mainly on review of programs. Since I left, it's really review of strengthening program implementation. Like for example, in the case that I've mentioned for the Global Fund program, was a review of the performance of the Global Fund. And if you look at page, I think there's a page there in the same where I talked about the earnings. So that
it is not about earnings.
Yes.
I'm looking at what the copies that we wanted.
Yes.
We thought maybe you have written any report.
For the consultants. Yes, the reports that I generated are really for the clients. Like for example, this case, the Global Fund.
You could have indicated. You could have indicated. Yeah.
On the other side, you'll see a list of publications that I have.
Yes.
Yes.
Which is good, but you could have indicated.
Here.
Yes. That maybe you have a number of reports, but they were basically for your clients.
Yes.
If you could have indicated that way, at least we could understand. Based on the experience you have shared to the committee, and you wrote not applicable. Not applicable means there's nothing, absolutely nothing.
Can I explain that?
Yes.
Okay. My understanding here is that really more of political party and things like that. That I was.
You are on page 4 of 8.
Yes.
19B.
Yes, which is on my side. So that was my understanding. Otherwise, if it was, if the interpretation,
read that part.
Yes, list all membership, officers held and services rendered, whether compensated or not.
No. Number 19B.
19B.
Number page 4 of 8.
Yes. Or supply copies of reports, memorandum, policy statements you prepared or contributed in the preparation for any bar association, committee, conference, or organization which you are a member. So here it is focusing on membership. That is why I didn't.
So you are not a member of anything.
I'm a member, but in those organizations I've not prepared reports.
And you are consulting.
Yes. Because for the organization, it's not a membership, it is consultancy. But that is my interpretation. But if the committee here believes the interpretation is different.
Not believing. Yes. We are reading what is here.
Yes.
Yes. I believe is not a proof.
Okay.
I believe you know very well at your age, you know that there are so many things that you believe they don't exist.
Yes.
And the other things that you believe, you don't believe which they exist. Yes. So read as what is here.
Exactly.
And with your experience.
Well,
is this the best response you could have given?
If I didn't respond to that question according to the expectation, then I would apologize. But that was my interpretation at that time when you talked about policy statements and memorandum.
Okay.
Which are not, I haven't.
Okay, well, maybe I'll make more inquiries as I go through. But I wanted to get clarity. I was trying to follow the consequence of the events you have been doing, your professional undertaking, among other issues. But the committee tends to believe that you are more of a consultant now, which means you have more experience, and you have been assisting so many counties, districts, provinces, and even other countries. That is what we share. That's why I was concerned about this particular question. Okay. Members are also going to ask you a number of questions. This was just an introduction part of it. So allow me to give to Honorable Tom Jengo to make some inquiries.
Thank you, Chair. Mr. Peter Morobo Sama. Congratulations. You're welcome. Looking at your age and the age of your father,
I wouldn't know.
I'm the one confirming that because I know your age, you don't know my age. Okay? So, again, in cognizant of your net worth and the fact that you are a retiree, don't you think it's high time you should be at home enjoying your retirement benefits?
Well,
That is one. Two, you being a retiree and you know the world is now struggling with unemployment, don't you think you're denying an opportunity to a youth who might have struggled in his or her education, and this opportunity also lands on me, who is a retiree with a very good network? I think you can answer those first.
They say age is just a number. I think what is important, what I bring to the table is the experience that, to me, given that opportunity to be able to deepen that experience within my own county. That is something that I cherish, and I take it as an honor. Number two is that given my networks and organization skills that I bring to the table, the work that I'll do may create more opportunities for youth than that just one position that I may occupy. So, looking at how can we be able to bring other resources into the county other than what the county treasury, what we depend on from the national government, looking at other sources of funding. And if those opportunities appear, you'll find that probably you will create more opportunities for growth rather than that position. So that is what it is. And I hope.
Before we even proceed, go back to the questionnaire. Go back to the questionnaire, please. And you know where we are reading? Number 4 of 8, page number 4 of 8. You are reading number 19, B.
Yes.
Just go to 20.
Yes.
When you are talking, when we give you an opportunity to tell us about yourself,
Okay.
you do not share.
Oh,
about
I
it.
forgot about that. 2018. Okay.
2018,
Yes.
and even now, it appears you are the chairman.
Yes.
Just read so that members of the public can understand. Because we are online,
Okay.
they understand the position you are holding.
Yeah, in 2018, I was called upon when the county assembly established what we call Health Services Fund Board. The idea then was that the funds that are being generated from hospitals, the user fees, need to go back to improve the services in those. So I was called upon to chair that Health Services Fund Board. It was established. I think it's one of those, I think there's 6 counties in this country that went into that direction in terms of because of addressing some of the health gaps that are there. So we established the fund. Initially, we started in 2018, and there was the act was passed by the county assembly. However, there was a challenge with that act, operationalizing it, because of certain gaps which were identified by the control of budgets. So we had to go back to the county assembly again, be rectified, which was done. We started the operation, and at that time the collection within the 5 hospitals which we were looking at was about 68, 70 million.
What are those hospitals?
Hospitals?
Yes, so that we know which hospital.
Kilifi, Malindi, Madiakani, Bamba, and Japan. There were only 5 hospitals. Recently, I think 4 more hospitals have been added through gazettement, but they have not started that process.
Which are the 4 more? Because you are still the chair. We need to know.
Yes, the 4 more, we have now gotten Marafa. We have now added Mtwapa, which was not there. Bamba has been now formally gazetted, so it is making that.
You had mentioned Bamba in the first.
Yes, it was mentioned. However, I realized that it had not been gazetted, even though it was being implemented under this act.
So what?
But it has been gazetted now. So
the other two you have mentioned two now. New.
Yes.
The others?
Said
Marafa,
Bamba, Mtwapa, and of course, Jibana has now been formalized.
Can you tell us how many health facilities? In total? In total, we have about
the
ones which are gazetted.
The ones at nine hospitals.
Yes, you can mention them. As a chair, you must be knowing those facilities.
All those hospitals.
Yes.
The 9 of them.
Yes. Let's go back one by one.
One by one. Of course, we have the referral hospital Kilifi. We have Malindi.
There's a book there, I think you can.
Yes.
You can note that.
So we have Malindi Hospital.
Yes.
We have Mariakani. We have Bamba. Going that direction, we have Jibana. Then we have Kilifi, which is the county referral hospital. Then we have now Marafa. We have those are 1, 2, 3, 4, 5, 6. Gede is a hospital, but I would put it in there.
You must be knowing the facilities which are gazetted. Just mention them so that you know.
1, 2, 3, 4, 5. Did I mention Mtwapa?
Yes.
Mtwapa.
You are in fact you are breaking.
Yeah, Mtwapa is one of them. So that makes it 6. Did I mention Jibana? Did I mention Marafa, Malindi, Gede, and so that was 1, 2, 3, 4, 5, 6, 7, 8, 9.
The committee is dealing with the chairman.
Oh, okay. Mariakani is there. Mariakani is one. Out of these, from the...
We are remaining with 2.
Yes. 1, 2, 3, 4, 5, 6, 7, 8. No, it's 9.
There are 9?
Yeah, from my list.
Okay, read them so that you can...
I'll start from the bottom. Mariakani, Gede, Mtwapa, Marafa, Kilifi, Jibana, Bamba, Mtwapa. Okay.
You are reading Mtwapa twice?
Oh, I had written it twice. And Rabai. Rabai is one of those hospitals.
So those are 8.
Okay. Okay, I have the list, but
okay, thank you.
But for the first, can I continue with what?
Yes, continue with what you are telling us about the trend.
So the 5 hospitals that we were dealing with initially, the collection was about 70 million. That is 68. That was about 68 point something, about 70 million a year. We realized that there was a challenge with the collection.
70 million a year?
Yes.
A financial year, that is?
Financial year.
Yes.
We realized
for the 5 facilities?
For the 5 hospitals.
Yes.
We realized that there was a challenge with the collection. Number one is that the personnel that were collecting the resources, the money within the hospitals were casual. And these casuals are paid only. And some of them are collecting about 20 million shillings a year. I mean, 20 million shillings a day. So you can imagine the temptation. So one of the things that we did to sort of put control was to introduce what we call a cashless system. And today, if you go to the hospitals, you'll see that you have to pay through M-Pesa. That was one of the.
You visited those facilities?
Yes, in
in
fact we rotate. We rotate our meetings.
Okay.
We rotate our meetings so that because we don't just deal with theory. we go to the facility, look at the situations. So out of that, what we have seen, one of the things that we've been able to do is to bridge the human resource gap in those facilities, particularly with temporary personnel that can be able to run the services using those resources. We've been able to improve infrastructure in some of those facilities, like repairs. Like for example, if you go to Malindi Hospital today, you see a new pharmacy. We are able to construct that using the facilities. We were able to, if you go to Mariakani Hospital today, there's a fantastic dental unit that you would probably get at Aga Khan, you know, which is funded through that. The human resource gap in this facility.
Please, just repeat so that we can understand. If you go to Mariakani, you find what?
A dental unit that will probably match what you would get in a private facility anywhere.
Like Aga Khan.
Yes, it's really fantastic. One of the places. It's just that a lot of these things are done, but they're not publicized, so people don't know.
We have been there. That's why we are very keen.
Yes.
We want to hear what we are going to share. We have been in all those facilities.
So one, and then the other thing is that because of the delays in getting funds from the national government, there are gaps where sometimes there are no drugs in the facility. So through this, we've been able to bridge, you know, making sure that the essential, because the fund is not very big, the essentials you will not be able to, at least, you know, they are able to procure and bridge the gap when there are delays. Like now, right now, if you go to a lot of those facilities, because of the delays in funding, the gap is met by this fund, of course, you know. So out of this, we've been able to generate, with the improvement that I've talked about, the fund now is able to generate 206 million from 70 million. And
270 million for financial year.
276 to be precise. But still has not reached the optimum yet, because right now the next phase in, of course, closing the pilferage. There's a lot of pilferage. So to close the pilferage that is happening in these health facilities, we need to implement EMR systems, electronic medical records, that is looking at, you know, both the patient and the supplies, so that we're able to know why a particular patient so much was used when actually it should have been just one item or two items. Because right now you cannot account for the number of patients versus the number of supplies and drugs that are being used. So one of the things that we need to put in place is making sure that we have an EMR system, and that this is, you know, one of the immediate priority things that need to be done to be able to close the pilferage that happens in this.
Now, Chairman, if I may inquire from you, as the Chairman of the Kilifi County Health Services Improvement Fund Board, as you are improving all those facilities, did you manage maybe to inquire about the ambulance services?
The ambulance services, yes. We have the main challenge that is there is that the first generation ambulances that were old are now almost becoming dysfunctional. They're breaking down, they're old, so that is really a priority. But in terms of the funding that is coming from this stream, it will be very difficult with the resources. So this is something that needs to be factored in the budget for the county health department going forward. And it's not just the buying vehicles that, you know, are not meant to be ambulances, and we call them ambulances, and that is one of the main challenges we've had. We need to buy proper ambulances where you transport a patient and you know they'll arrive from point 1 to point 2.
Can you tell the committee, probably from 2018, that was 9th March 2018 to date, How many ambulances have you procured?
No, from this one we have not procured ambulances.
And have you ever written anything to inform either the department or the governor about it as a chair?
The fund is supposed to be improving the services at the health facilities.
It is also a service. Ambulance services.
It is essentially a service.
And you are a consultant.
Yes, but given the volume of the resources, priorities, we were prioritizing first of all the human resource, which has been really the major gap, and again the drug procurement and those critical services that we identified, like for example the pharmacy, the dental.
So from 9th March 2018 to date,
yes,
you have been concentrating, and you are concentrating on the human resource in those facilities.
That has been the major challenge in this.
So you mean if the committee inquires or moves around, they will find that the human resource is well fixed in the 5 facilities?
It's not well fixed, but it is better than in most facilities that have not had that fund. It's not fully fixed because the human resource gap in this country, the health sector, is humongous. It's because, you know, as you know, we moved from probably about 80 to 90 facilities to 143 facilities. So all those facilities require staff. So that's one of the things that needs to be fixed.
You can imagine, from 9th March to date, the period you have taken to try to fix the human resource, and you have failed to. And probably if you get this position, the longest period you can be there is only 5 years. Will you be able to fix the other issues in the health facilities?
Okay. There are 5. There are
because it was only 5 health facilities.
Yes.
And you have taken all that long.
Yes.
Without managing at least 75%.
Yes.
What do you think will happen if you are given 5 years?
Yes.
To fix the major issues in all the health facilities across the country?
Thank you very much. One of the things in the health system, there are 6 pillars. There are 6 pillars of the health system, Mr. Chairman. So in those 6 pillars, one is infrastructure, which in a big way has been addressed, not quite still there, that needs to be addressed. The other is the quality of care itself within the health facilities, and this has to be managed from several approaches in terms of strengthening supervision and making sure that people have the right system to be able to operate. The other thing that we need to fix is the drug supplies, making sure that we have the proper quantification, and then fixing the ordering system. Of course, we still face challenges with KEMSA, because that is another problem where we have. Then the human resource. So my first priority is really what I have gathered, because that was not really our mandate. Our mandate was really to make sure that we collect and improve the services within, but looking at having a very good plan with the county public service board to look at this human resource and fix it once and for all, with a view of the long term. So it is possible some of the things, the issue is things need to be prioritized, because you can't say you're going to do everything in the first year. So what we need to do, which I am prepared to do, and one of it, I think His Excellency the Governor has already taken a very good step, which is really in the right direction, almost made by work much simpler, by establishing the task force on health systems. So out of that, you draw a plan on how to implement the task force recommendations immediately. And I've talked to members of the task force, and I've clearly told them that we need to prioritize. We don't just throw and say do this. We need to say this needs to be done first, this needs to be done second, this needs to be done first as we implement to improve the health services. And then the other thing is task force on human resource. That is drawing from the task force recommendations that are coming out from the task force, pulling out the health sector recommendations and implementing them immediately. It is possible. It will not solve everything. Health sector has a lot of challenges, but we'll go a long way in solving the problems in the health sector using the resources. Because here we are talking about just a collection of about 70, and this year we managed to reach 1 million. But a lot of the issues that need to be solved, it's a question of combining the budget that we are getting from the national government and what we are collecting from the user fees to be able to address the issue. But it's possible, Mr. Chair.
Honorable Tom, you had some issues to clarify.
Mr. Peter Morogo, you remember my question, I am aware of answer, but I have a follow-up question.
On the same?
Yeah. I'm made to believe by your questionnaire here, you were employed at the age of youth.
Yes.
Right?
Yes.
Did you have experience by then? You didn't have. So if you bring in the issue of experience here, that means you are a bit selfish because you are denying that youth because of experience. That would be a bit selfish, right? No, I don't want to answer you. Not that you answer me. Again, you being the CC nominee, once approved with the CC, you are the vision carrier of that department. And I had that question prior, but in your deliberations, it's like your vision is anchored on the task force formed by the government. So on your own, you had no vision on how you're going to transform the status of the facilities. Because I'm aware, you being the chair, and you have confirmed to this committee, you have been advising across the facilities, you know the pathetic status of the facilities. So that should have been in you, and having gotten this opportunity, you must have a vision on your own on how you're going to transform the status of the facility. So can you, in a brief way, share with us the vision that you have? Thank you.
First of all, I would like to correct the interpretation that I'm relying on this. I said it's God sent, that is already there, because it has been part of my thinking already. However, we are looking at the broader vision. My broader vision is the implementation of universal health care in Kilifi. From theory to practice, really making sure that, because when we talk about universal health care here, we are talking about making sure that the human beings have access to health where they need it, when they need it, and at an affordable cost, so that cost does not become an impediment. That is the broader vision. In any part of this county, people should be able to access health care without any impediment when they need it and where they need it. So how do we do that? We do that through looking at the health systems approach and strengthening the health system from the bottom. We need to make sure that the health facilities at the bottom, the dispensaries and the health centers, it's a pyramid kind of thing, are strengthened, and they have the right personnel, they have the right commodities, they have the right equipment to do that diagnosis, so that we reduce the movement of patients from the lower level to the higher level, only going to the higher level when the competence of the provider there is not to what is required in terms of managing the patient, and also the facilities that that level doesn't have, has at the moment, is not sufficient to be able to address the needs of that particular patient. That's when you move. What is happening right now is not referral, because we keep on saying the patient has been referred. What is happening right now is not referral, it's transfer. You refer a patient when you don't have the skills, you don't have the right diagnosis to be able to manage that patient, then you refer. But at the moment, when you are out there, you are alone, so many patients are there, you're saying, Peleka Malindi. That's not a referral. So we need to strengthen the base. So at each level, we make sure that we are adhering to the Ministry of Health and WHO standards or norms and standards, or in terms of the equipment and the right personnel, and to be able to do the diagnosis and manage those patients at all the levels, so that we reduce the pressure at the top. Because what is happening right now is, like for example, we have this new facility in Kilifi which is not 100% operational, even if it gets there. If we don't strengthen the lower level facilities, that facility is not going to be enough, because everybody will be rushing there. But you should be managed here, and only very complicated cases are go there. So that is really the vision I have. And then we need to look at how can we improve our drug and commodity supply. How can we improve, and that is really my thing is, how do we reduce pilferage in these health facilities? Addressing that is going to be very, very critical, because you can throw in so many resources, but if the people who are there are not managing the resources well, will not be doing anything. And that is the challenge that we have. We need to improve the management. A lot of our hospitals are managed by people who shouldn't be managers. They are clinicians, they are taught to inject, to diagnose, and we throw them from school. We tell them, run this health center and health facilities. They are lost. I've talked to some of them. They have no idea of management. We need to strengthen the management system of our facilities so that they get back. There used to be a training program in this county, run by Danida many years back. Not only this county, this region, the coast region, from Taita to Lamu, was an example of good management of health facilities. When that cohort of managers left, with time, we have not invested a lot in training new managers. So we have thrown people, bring from a clinic, this clinic, go and run this hospital. We need to invest in making sure that our facilities are run by people who have an understanding. There could be clinicians. And the clinicians can be, trained and have seen it happen, and they can manage those facilities well. The other thing that we need to address is at the primary care level, the prevention. We need to invest in community health volunteers. We shouldn't wait until people get sick. We need to have armies of community volunteers. And for that, I'll beg the indulgence of the County Assembly, Mr. Chairman, to make sure that we fast-track legislation to anchor the community health volunteers into the health system properly. Right now, they are there. We have about 80 community units, whether they're functioning or not. Some are functioning, some are not. Quite a number of them are supported by development partners. But if we have, then we are able, one of the dockets in the health sector is going to be the sanitation part. The sanitation part is at the community level. We need to make sure that we make Kilifi open, free, defecation, building toilets, reducing diarrheal diseases at the community level. Making sure that communities are reached with information on how to prevent themselves from diseases. We need to invest in that area so that then we reduce the number of people who are getting into the health system. My vision is big, but it is achievable with your support, of course. There are many players. Health is one place where it's multi-sectoral in the sense that you have to collaborate with different sectors to be able to achieve what you need to achieve.
Okay. Thank you, Chair. Congratulations for your nomination. I would just like you to explain to us in a layman's language, and based on your experience and your expertise and how you've interacted with all these hospitals, I would like you to tell this committee, what is your opinion? In your opinion, what is the cause of the increase of prostitution, teenage pregnancies, and the increase of drug and substance abuse in Kilifi County? Secondly, what actions are you planning to put in place to curb this menace?
Thank you, Mr. Chairman, through the Mr. Chairman, for the question. It really goes into the area of prevention. This county is one of those counties that have gone on record. I think it's probably the third, or this is the third in the country on child pregnancies. This is something that we, in my view, of course prostitution has to do, it's related to this, because what happens is that, these kids get pregnant early, drop out of school, they don't have economic means, they go into prostitution. So one of the things that we will, I intend to do is to strengthen the school health program. Getting these children, the ministry has a guideline for what we call age-appropriate education on health for these girls in the school. The problem has been the school system has been emphasizing on academic performance, the pressure. So these unexaminable subjects are not given a lot of emphasis. So school health has been one of those that we have neglected. So that is one entry point where we really strengthen school health to address the issues and drug abuse and early pregnancies within. But that is not enough. We need to go to the community, because these girls are not doing this out of nowhere. They're doing it within the communities. It is happening to them within their context. So that is why the community health strategy is going to be one of the biggest strategies to be able to address, because we here through the community volunteers we are able to visit household to household, support mothers, support parents to be able to address some of the challenges that their children are facing. So if we do this two-pronged approach, support the community and also support the school system to address this. But thirdly, there are those people who are already there. What do we do with them? They are our children. We need to work with rehabilitation centers very, very closely to make sure that those who have already gotten into that problem are supported and they are able to be reintegrated back and get back in the community. And also, through the community education, get people to destigmatize these people when they get back to the community. Because sometimes when they get into that problem, and even if they are in their path to recovery, you'll find that the community has branded these people as Uyonimtua, Waunga. Then it makes them very difficult. I mean, it gives them a very hard time to be able to reintegrate back to society and get back to normal. But I have seen people who have been supported through counseling to do these drug rehabilitation centers, won't name names, but one has even gotten to the level, went back to school, proceeded, and now is a doctor. He managed to graduate. Otherwise, this is a person from this county that would have lost, if that support system, if their parents would not have had access to support. So it is possible to address these issues. They are challenging, but they are surmountable. But it is a process that we all have. Leaders have a role to play, school system has a role to play, community health workers have a role to play. So in our approach, in my approach, as the Department of Health, is to make sure that we strengthen all these levels so that we can be able to address that vice.
You can write those questions and respond to them.
Yes,
Yes.
again. I want to take you back page 20, number 20, page 4.
Yeah, okay.
Are we there?
Yes.
So you were elected by board members as a chairman.
The first time in 2018, I was appointed by the government to chair the board, and the letter specifically said that. Now, when the first term, because it's a 3-year term, renewable. When the second term came, I was appointed as a member of the board by the CEC. So then the board members are elected, and I was elected to continue. So so there have been two parts. There was appointment, and then there was the election.
I want to take you back to the Kilifi County Health Facility Improvement Fund.
Yes.
The bill itself.
Yes.
What is the procedure
For
the appointment of the chairman?
For the appointment of the chairman, according to the appointment of the chairman is in the initial bill was
This is Bill 2016, right?
Yes, Bill 2016.
It is now an act.
An act.
Yes. So what is the position?
The position is appointment by the governor or a representative.
So remember you are on oath, and here you indicated that you were elected by the members.
Yes.
Not the governor.
That is what happened. That's why I like being truthful, because what happened is that a representative of the governor appointed me, CEC, and then within that whatever, he's the one who was chairing that meeting on that particular day.
So the function of the board, one of your function is oversight, right?
Yes, sir.
And how can you explain the hospital finance management, like Malindi Hospital? The hospital collects around 4 million every month, and in NHIS it collects 5 to 6 million.
Yes.
How does that reflect in the finance management of the hospital?
Each hospital has an accountant, and so each hospital has an account. So through this account, all funds that are collected are deposited in that account. Then initially what used to happen, this is a transition.
So you understand it, man? You understand the question? Because we know that we have accountants, we have the procurement department.
Yes.
Is it normal that we have a collection in insurance policy, like NHIF,
Yes.
more than the cash flow?
Yes.
Is it normal?
It is normal. I'll tell you why. The procedures particularly in a lot of the money that is being collected on health insurance fund is through procedures in particular admission and particularly maternity. It brings a lot of resources. Once you open your maternity, a lot of these private hospitals are thriving on that because of the fund that you get to the NHIF. So the funds that are generated, however, there was a problem, and we fixed it in a big way. And this is a lesson learned that we need to implement in all the hospitals. What used to happen, the collection from NHIF was very low, and the reason was a lot of our claims were being rejected. Why? Because they were wrongly billed, wrong billing. And what we realized is that the hospitals were using what we call lay people who are not medical. They would be placed in those places and they decide on, this procedure is so much, this procedure is so much. So we changed that. We said it needs to be a medical person to be able to do a proper evaluation so that the billing is proper. Then, so we placed nurses, what we call billing nurses. This is where now the improvement really happened in terms of getting refunds from NHIF. Otherwise, we used to have a lot of. So we need to scale it up in all the facilities that have now been brought on board.
The question is, 70% of the money collected in that hospital is supposed to help the facility for improvement, right? We have cracks and painted walls, dirty linen in that hospital, no plates for the patients, and we have the collections, and we have a mortuary that is not functioning. Members of the family are forced to buy their own utilities for that services.
Yes.
So
this is thank you very much, Mr. Chairman, through the chair. I need to address the chair. This is what you're saying can be replicated to most of the hospitals. The challenges are big. So what we have is within the facility improvement fund, like I said from the beginning, with that money you prioritize where are the things, because you cannot do everything with the resources that you have. With the budget that you have, you prioritize. Then that's what has happened, because there are so many things that need to be fixed. And the facility improvement fund will not do everything. Some of that money has to come from what we call the county treasury, which is, was not part of our mandate. Our mandate was really to focus on what you're collecting, what is being utilized for. But the challenges of facing the hospitals are major, and they need immediate attention. They need huge resources though. So when the county assembly sees the budget for health, these activities are not cheap. A lot of Malindi Hospital, where you have mentioned, those buildings were built when I was young, when I was, some of those buildings since Rosinja, Dr. Rosinja.
But Mr. Marago,
yes,
the unpainted through the chair.
Intervention, no? Yeah. Rogo, you
yes.
said that you came to realize that you are losing a lot of money from who are billing.
yes.
And you decided to use nurses to do the billing. Is that right? Is that what you said?
Yes, it's right in the sense that what happened, you learn through best practices. We took the medical superintendents in these 5 hospitals to look at a best practice, because I had seen a best practice in the Rift Valley where the facility is able to have a proper system, and we realized that the improvement happened at a time when the nurses who are serving in those wards are the ones who calculate the bill, because they know the condition, what that condition should cost. When you put in a clerk, they would not be able to put the right bill. The initiation does not necessarily have to come from the nurse, but the nurse has to review to make sure that it's correct. What used to happen is that these clerks will just prepare this, and it goes to NHIF, and they would come back, and then the hospitals would complain, oh, our bills are being rejected, So we put those conditions, and it has seriously improved, reduced the rejection from NHIF. Back to,
yes. Are you aware that there are bills that have been placed in front of the governor that the county government is supposed to pay for a hospital in Mtwapa for meals, and that hospital we don't have inpatient? Are you aware about that?
no, Mtwapa was not part of our. Mtwapa has just been gazetted recently, so Mtwapa was not one of our sites. So I will not be aware about Mtwapa, but what I know is that generally the health sector has a lot of bills.
So you admit that we have a problem in oversight in this board under your leadership?
Not the board, because like I said, Mtwapa was not one of our sites. It is going to be one of our sites from this financial year.
And about the Malindi facility?
Yes, Malindi facility.
So it is not a priority to improve the mortuary, it is not a priority to improve the cracks and the ceiling that are broken. It is not a priority to have bed sheet for the patients. It is not a priority to have medicine for the patients.
Mr. Chairman, through your chair, I think everything is a priority. It depends on the resource envelope that you have. The resource envelope that we had was able to do what we are able to, what we did. The rest of the resources need to come from the bigger county health funding through the treasury, and those are the things that we look at. To me, I look at Malindi Hospital as, and all hospitals, of course. I mean, when you look at Jibana, or, I mean, so many things that need to be done. There is priority, there are things immediately that need to be done, including those putting, you know, making the place really look pleasant, customer friendly, and providing the quality of care that we require. Mr. Chair.
Okay. Thank you so much, Chairman. I've really been waiting for this moment. I have 10 questions, but I'll choose them.
10?
Yes.
Just read them so that you can note and
Okay.
respond.
I will try and minimize them, as I've done a little writing. I'm a mental poverty champion, and sometimes in our last assembly, I moved a motion on to the Department of Health, Gender, to provide sanitary towels to the school-going girls in Kilifi County. Tell this committee something about menstrual poverty, link it to the education situation of our girls in Kilifi, and how you are, given the position, how are you going to link the two departments, education and health, to make sure that this is done to our girls in Kilifi. That is one. Two, the beauty about this vetting is that we are vetting somebody who is already in the system, and I'm meant to understand that one of your work is to oversight the Department of Health and the Improvement Funds Board. Yes. Are you aware about our dispensaries in Kilifi County? And I will mention a few from where I come from. A dispensary like Mazimbani, Kamkomani, and Shangia, these are in Mariakani, in Kaloleni constituency, run without medicines, and they operate like government offices. Those dispensaries are opened on Monday to Friday, weekend of Hakuna. And given this position, what will you do different? Because I want to believe medical facilities are supposed to run 24/7. And another question, let me try and choose the last one. There are many. How will you ensure that patients who are differently able, these are people living with disabilities, receive good and friendly services within our facilities in Kilifi County? Last. In our last assembly, I also moved a motion about having self-havens, the rehabilitation centers, the ones that you were talking about. Are you aware that in Kilifi County, as a county, we don't have any self-haven where maybe people who have been GBVs or girls who are raped and all that have a safe place to go and maybe get counseling and all that? We do not, as a county, we do not. What we have in the county are privately owned, right? And as you were talking about drug addiction in this county, I want also, if you are given this position as the CEC of health, think of how methadone can be spread out to other facilities, because right now only Malindi is the place where methadone is being facilitated to our sisters and brothers and people who are addicted. Take for example where I come from in Mariakani. Mariakani is now changing to Kisauni, where women and people are being nabbed because of these menace. And if you are given this opportunity, please, from all that what I've asked you, tell us what you do differently.
Through Mr. Chairman, the link between poverty and menstrual hygiene is real. Young girls drop out of school because they cannot afford sanitary towels, and they feel ashamed to go to school, concentrate in school, and therefore it contributes to dropouts. One of the things that I have in mind in this, to address this context, is through the school health program and through working with development partners. This county is very lucky. There are quite a number of partners that probably whose potential we have not tapped to be able to support programs like this. So it's really to look at within our budget committee, kind of budget that we have committee, be able to have sanitary packs that are distributed to schools, but also tap into the ability and the resources that are available through the government partners to be able to make sure that there's a systematic distribution of what these days we call dignity packs to young people in school. So that's something that is a priority, and I intend to make sure that within the coordination with the health services of the county, we follow up on this and make sure that it's implemented. Like I said, on the dispensary issue, one of my biggest priority and one of the things that I really would like to do is strengthen dispensaries. Like I said, that is the closest where our people are accessing services. The first port of call is the dispensary. Making sure that they have the right personnel, minimum nurse, farm tech, and a lab tech, minimum, at least, or depending on the volume of patients. The issue of operation, I think there has been a breakdown of discipline, and this is something that I noted in visiting some of the health facilities. Breakdown of discipline, not just in the health sector, but I think in the public service in Kilifi County. That needs to be reined on. In my approach of the public health for the health sector is make sure that we reinstate discipline so that people know that they are supposed to work at particular times and the supervisors make sure that those people work. People who are working in remote facilities take advantage because they're hardly visited, so they don't open on time, they close early, or they don't open at all. The issue of drugs. One of the things is to make sure that my priority is to work with the team to have proper forecasting for drugs and have a proper distribution mechanism, but more so have accountability, because we don't, if we don't have a system where you don't know whether all the drugs are really being used for the patients who are said to be served, then you have a problem. So we need to, we have to strengthen that, making sure that we have proper, we call it pharmacovigilance, all those drugs, and make sure that they're properly accounted for, and make sure that there's a fair distribution in the health facility so that they're able to run. I know that is going to be quite a challenge because of the system that the national government has adapted, where we are procuring from KEMSA, and sometimes we have not paid. It's like going to a pharmacy, taking Panadol every day. You take Panadol, the next day you go and take malaria and you say, I'll pay tomorrow. The next day the pharmacy is going to say, I can't supply you anymore. That's what's happening with KEMSA. So we need to make sure that we prioritize paying KEMSA bills. Because if we pay, we get our drugs. And as long as you don't pay, then at some point they stop procure. And that's the challenge. That's the first thing that we have to make sure that everything else that comes, we have bills. The bills that are pending for drug procurement are paid first, so that drug supply system is not compromised. On disabilities, I think one of the things to review in terms of renovations is to make sure that facilities have are accessible to people who are challenged, people who are on wheelchair. We need to have ramps. That's a standard. But sometimes it's forgotten in the construction facilities to find, people have to be lifted because a ramp, proper ramp is not provided for people with disabilities. And then the other thing is making sure that people, service providers, are sensitized on disability-friendly service delivery. For example, if a person is deaf and they appear at a health facility, do we have a system for supporting them? You know, do we have deaf interpreters in these facilities? Where possible, we need to deploy them so that people have equal access to services. Then the issue of GBV and safe havens. Certainly in this county there is need for that, and budget allowing, that's one of the things that we need to pursue, but also look through development partners. We have approaching development partners who can be able to support the deployment of these resources centers to rehabilitate girls who have gone through GBV and who need support so that they can be able to be integrated back into society. I think I've addressed those questions, Mr. Chair.
Thank you, Mr. Chair.
Just reading that has been mentioned from the questions that are Bwana Peter.
Yes.
You said there's a breakdown of discipline by the healthcare workers.
Not just healthcare, I've seen it across. I think it's serious, Mr. Chair. When I started responding, I need to respond to you, Mr. Chair. We need to get back discipline in our workforce. And that has to be done through strengthening supervision system back to where
I just wanted a confirmation.
and working with the county service board.
I just wanted a confirmation that
Yes.
this is the statement from you.
Yes.
And you also went ahead to assure this committee that level 2 will be operational even weekends and at night. Is it?
We'll look at the regulations to make sure that what happens in those levels, with the health facilities being close by, the health workers should be able to respond to emergencies whenever they need it, in weekends and
why am I posing that? Because you have been on those corridors of health facilities and all
Yes.
that. So I expect you to be acquainted with the relevant regulations at the level of these hospitals and facilities. So dispensary is under level 2.
Yes.
And by the guidelines, they're not operated on weekends and at night. So for you to confirm here and an oath that this is, unless you promise us that you're going to change that.
We not, if we don't change the rules, Mr. Chairman, I grew up at Gede, and I would fall sick at night, and I would go to health facility at Gede, and we knock at the door of the service providers, and we would walk to the health facility and I get treatment. Why is it not happening now? Why is it that we have to say, oh yeah, you come on Monday, because the facility, it is an attitude of the service provider, and that is what we need to be working on, because health does not wait. Some of these conditions can be met. Somebody has, is bleeding, they have, had an accident or minor accident and cut themselves. You cannot stop that person because you're saying, oh, me, I am working from 8 to 5. Health service is a calling. Medical service is a calling. And it is a question of instilling this attitude of service providers that they're there to help the community.
Through the, you're saying you used to knock.
Yes.
That is when the doctors reside within. But in most cases, the dispensers have no doctor's office. Whom will you knock at?
But most of them live within those regions.
It's unfortunate you are confirming that, but we shall need to confirm it later. Another issue is on the prioritizing of payments to KEMSA. Why should you prioritize paying KEMSA if monies are already budgeted for that? I believe every payment must be paid. Why should you prioritize payment to KEMSA while there is money to pay every? It should be paid every now and then. Unless there is under budgeting on drugs. That's where now sometimes we fail to buy drugs for
From what I have gathered, because this has been a major concern when we always go to hospitals and they tell you that they have not had drugs, is that KEMSA has not been paid. So it means that when we are making our requests for payments to treasury or for paying our bills, we are not prioritizing KEMSA. I mean, right now we have I have heard at the government talking about serious pending bills to clear for drug procurement. So it means at some point, at the point of decision making, it's not a question, but what is pending needs to be paid on the resources that you have. And that is so that you can be able to assure a continuous flow of drugs in our health facilities. Otherwise we'll be here singing, we go knock, we buy, we run away from KEMSA because we have not paid our bills, we run to meds. I mean, the same meds, at some point you'll say enough is enough, then you have nowhere to go. And the regulations are such that those are the places that you can be able to procure.
Honorable Cindy, please.
Thank you, Mr. Chair. Peter.
Yes.
How are you? I think everyone knows you from the NGO world. I've heard about you, but I've never seen you. So maybe my first request is all those projects that you assist, mostly in Kwale, because you've done a lot of sanitation, and they know that. Maybe now you can transfer some of them to Kilifi, because sanitation in Kilifi is very wanting. So prioritize that. Secondly, that's the first one. Secondly, we are emerging from COVID-19, and there's an alert now on Ebola. So what are your plans to deal with this pandemic?
Thank you. I said, Mr. Chairman, from the beginning that sanitation is one of those priorities in health, and I will make sure that working through the community health strategies, we are able to address the issue of sanitation in our community. This is where prevention is key at the household level, and making sure that we increase the number of villages that are declared open defecation free. That is one of the things that I want to prioritize once I'm confirmed to this particular position. But I would say health is a multi-sectoral. There are other disciplines that also have to do with this. So I intend in this work to collaborate very effectively with the Ministry of Water, because sanitation is not sanitation if you don't have water, so that you don't address waterborne diseases. We know there are challenges in this county of ours where water is scarce. So we need to make sure that even in the situations where water is scarce, people have access to water that is free of diseases. Emergency response is going to be one of our challenges. I think the COVID-19 taught us that we cannot sit on our laurels and think, today it will be Ebola, tomorrow it's this and this disease. We have to have an efficient emergency response mechanism for these emerging diseases. So one of the things is to strengthen our surveillance system within the county to make sure that we are monitoring what is happening globally, what is happening in the region, and what is happening in the country, so that we can be able to respond. So it's really strengthening the system that we have to sort of make sure that we are always on the alert. We are not caught in the system. And even though I am not in the entire health system on the fund board, when the Ebola emergency emerged, I called the Kilifi team and I said, you know, Ebola is here in Uganda. We need to make sure that we are prepared, you know, so that we don't wait until it happens in the country. So our emergency response will make sure that it's really on the alert. We have a proper surveillance system, and we are able to track what is happening and be able to respond effectively.
Mr. Morogo, yes. Allow me to give a number of to give their questions. I will note them and then respond to them. Will that be okay with you?
Fine. I'm here for this.
We want to catch up with time.
I'm here for this.
We'll start with the Honorable Ibrahim and
Morogo, habari yako?
Mzuri.
Uko sawa eh? Wakati tulipokuwa tunajitambulisha sisi waheshimiwa, mbali na mwenyekiti wetu, tumejitambulisha sisi sote majina hapa. Unaweza nitajia jina yoyote hapa ule ambao inaliza kukumbuka vizuri?
Nakumbuka
bali na mimi. Tajie member yoyote ambaye yuko hapa katika committee.
Chairman.
Bali ni mimi na chairman tuweke kama.
Nakumbuka madam hapa.
Anaitwa nani?
Sioki. Unajua mara ya kwanza kama utakutambulisha wewe ukiwa uko huku inakuwa ngumu.
Unajua kwa nini nimekuuliza swali hilo Morogo?
Lakini sura hata nikionana naye pahali
si mambo ya sura. Unajua hii wizara ambayo tunakupa si wizara ndogo. Na unatakana unakumbuka mambo mingi sana. Na kulingana na huo umri uliona wewe ndio nimekuuliza hilo swali. Kwa sababu hatutaki tukupe wizara ambao kila time tutasema kwamba umesahau. Ndio nikakuuliza, tumejitambulisha sisi sote hapa. Tumejitambulisha.
Ndio.
Ili tujue ya kwamba kweli utakuwa mkakamavu kwenye hii wizara yetu. Kwa sababu tunataka tufanye kazi kwa bidii. Kwa hivyo huwezi kumbuka.
Kumbuka
baadhi. Tajie hebu tafadhali.
Nakwambia
ili nijue uko active kwa hii wizara tukikupa. Haya sawa. Bwana Morogo sasa. Bwana Morogo, katika hii elimu yako umetaja umesoma Gede, umesoma university sijui. Lakini kuna university moja ninaangalia hapa hukuitaja na sijui ni kwa nini hukutaja. Sasa mimi nimeiangalia kidogo inanipatia tashwishi. University yenyewe inaitwa Tulane. Ni ya wapi ni?
America.
Ni ya Tulane. Tulane ni ya Amerika?
Yes.
Ulisomea nini huko?
Nilisomea nimesema kwamba nilienda Amerika kusomea masters in public health management.
Ulisomea?
Public health planning and management.
Tulane.
Yes. Inaitwa Tulane, so iko New Orleans.
Okay. Then I've seen you drinking a lot of water there. Do you have any health problem?
Water is healthy.
No, I'm asking if you have any health problem.
So far, no.
Yeah.
I'm very lucky. I just did my annual examination last week. I do my annual medical exam, which I encourage everybody to do.
So you don't have any chronic diseases?
I was declared fit.
You have that report?
No. It was for my own personal. I do annual. It's advisable for us to be doing.
Yeah. Okay, the last question, Morogo. Unaona umefanya kazi kwa mashirika mengi sana. Na umekuwa msaidizi kwa hii kaunti yetu ya Kilifi. Na umetoka katika ward ya Watamu ward. Na mimi kama mheshimiwa wa ward ya Watamu. Sasa tuache kando serikali. Sasa wewe kama mwenyeji wa ward ya Watamu. Watamu tuko na clinic, Dimba dispensary, Watamu dispensary, Baraka Chembe dispensary. Katika hizi clinic tatu wewe kama mkaaji wa kule, kuna ushauri gani umetoa ama chochote kusaidia ile clinic ili nione ya kwamba wewe una fit kwa hili nafasi?
Kusema kweli katika usaidizi wangu wanachama, nikirudi kwako, ni kwamba nimekuwa
na sikiza. Unajua umeshika Biblia hapo? Umeshika na unaenda kanisani?
Mimi ni mwenyeji wa kanisa ya Gede St. James. Pia ni kama mmeona katika CV pia niko ni council member wa Mombasa Diocese Research Council.
Hebu elezea ili usidanganye.
So ndio nakwambia usaidizi wangu katika eneo letu limekuwa katika level ya county. Nasema katika level ya county level, sio katika chini katika dispensary. Nimesaidia establish kuanzisha matibabu aina mbalimbali katika county hii, hasa kushauriana sana na
mambo ya county. Tuongee kuhusu ward. Mimi
katika ward
hakuna
interact.
Kwa hivyo hakuna chochote, hakuna usaidizi wote umewahi, hata ushauri
directly bado, lakini katika ushauri ule ambao nikiongea na district ama county health, unajua it percolates down to the entire.
Unajua Marogo. Wewe. Hii kazi ambayo unaitaka, si ndio?
Yes.
Ambao umekuwa appointed hapa, sisi tumekuja kukonvert leo. Ni na hili swali ambalo mimi ninakuuliza, ninataka pia wenzangu waelewe, ili ya kwamba wewe pia ni umekuwa ukivolunteer kule. Sasa ikiwa wewe katika wodi yako mwenyewe pale ambapo umetoka hakuna usaidizi wowote ambao umefanya kusaidia, ama ushauri ama nini, ni wale wasome ambao sema wachana nao hawa.
Wacha ni kama unasema ushauri na usaidizi mbalimbali na chama. Miaka kadhaa iliyopita, na wakati nilikuwa nyumbani nilikuja nikafanywa na vijana. Ndio hii tabia ilikuwa. Na nilikuja nikafikiria sana. Nikasema kitu gani ambacho kinaleta tabu hii? Nikakuja kukuta kwamba ni hali ya ukosefu wa kazi. Na ukosefu wa hali ya kujikeep busy kwa vijana. So nikaungana na baadhi ya watu wengine tukaanzisha kuanzisha kinaitwa Gede Community Resource Center.
Sasa mimi nakuulizia mambo
Gede Community Resource Center iko pale. Hata ukifika hapo leo, nikafanya bidii nikapata wafadhili wakaweka computers pale. Vijana wana access, wanaweza kufanya CV zao. Hivi sasa nikafanya mipango na organization ambao inawatrain kuanzisha biashara ndogo ndogo. So kuna vitu ambavyo umefanya katika community, lakini mimi huwa ni background, huwa sipendi sana kusimama mbele kupiga makelele.
Kwa hivyo sasa hii utasimama mbele, tulikupa nafasi.
Utasimama.
Napita Marogo Samuel. Under your leadership as a chairman, katika naona ni department hii ya health, ni mambo gani unaweza kuelezea kwamba ulifanyia wana Kilifi so hii committee hapa iwe convinced so that tukupatie, maana hiyo department ambayo uko na hiyo cheo ulichokipata pia kilikuwa ni kikubwa. Chairman ni mtu mkubwa katika panel yoyote. So wewe ulisaidiaje wana Kilifi under county level? Kwa sababu nimesikia ukisema kwa ward level hukufanya, lakini at least wa county level, especially hizo hospitali kubwa, tuambie ulikuta vipi na sahi hapa tulipo umevifanyia nini?
Asante, nimeshukuru kwa swali hili. Nafikiri nimeeleza kwanza kabisa kuanzia mwanzo kwamba tulipoanzisha hii kulikuwa mapato ambayo yalikuwa yanapatikana katika collections za health facilities kwa madogo. Wakati huo walikuwa wanafikiri wanatoa pesa nyingi, lakini nilipoangalia nikasema hapana, potential hapa ni kubwa zaidi kushinda vile tunapata. Lazima kuna pesa inapotea. Kwa hivyo kufunga zile areas ambazo zilikuwa zinaleta tabu, tukajaribu. Unakuta kila mwaka tumekuwa tukiongeza mapato, na hiyo pesa inaenda kusaidia improve services. Si 100%. Manake pesa ambayo inapatikana katika health services fund haiwezi kurun health facility yote, lakini kuna vipengee ambavyo tunaweza, kama for example nakwambia, kama ukienda Malindi Hospital ukiangalia ile pharmacy ile block, ulikuwa ukienda Malindi Hospital, hata kuna wakati nilikuja nikawaambia kwamba hii pharmacy on poisonous body itakuja kufunga hii hospitali hii. Madawa yanarushwa huko, na unajua zikirushwa hivyo ndio pia zingine zinapotea. Sasa tukasema tujenge pharmacy, tujenga, imekuwa kidogo mwaka huu ile kwa unapata unaongeza hivi sasa iko fully complete running. Ni mfano tu mmoja. Kwa upande wa human resource, hizi hospitali nilikuwa nakwambia, ukifika katika department nyingi zilikuwa hazifanya ushauri ya kuwa hakuna kazi. Kwa hivyo kulingana na kufuatia hii fund, tumeangalia zile department ambazo zilikuwa zina matatizo makubwa zaidi na kupatia wafanyakazi ambao wanashikilia. Tungoje Public Service Board wakiwa county iko na resources za kutosha waweze kuwachukua, at least services zinaendelea. So ukifika huko pata services zinaendelea. Jambo lingine ni kwamba wakati county imechelewa kupata pesa kutoka kwa treasury, ambayo hiyo ni kawaida kila financial year, kuna gap kubwa ambayo inatokea. Tunaangalia yale madawa tunaita madawa essential drugs, zile ambazo ni muhimu kabisa ambazo zinatumika, na tunawaruhusu wale wakiwa wakingoja hii supply ya kutoka KEMSA. Kwa hivyo na hiyo imeendelea. Kwa hivyo kuna hayo ambayo mimi naweza kusema, nikiangalia nyuma, kama si hiyo tungekuwa katika matatizo makubwa zaidi ya vile ambavyo mnaona hivi sasa. Mnaona matatizo, sote tunaona matatizo, lakini kama si hii tungekuwa na matatizo makubwa zaidi. Maana health services zilikuwa haziendi, wafanyakazi hawako, kwa hivyo sasa wako. Kwa hivyo naweza kusema tumekuwa na success katika hizi.
Bwana Marogi, tukipata huo waziri, let's say leo tuko waziri wa health. Hayo yote uliyopitia, changamoto ulizopitia, una plan gani za kuzisolve?
Changamoto kama nilivyosema kwanza kabisa, lazima tuangalie infrastructure ya health facilities zetu. Yale marekebisho ambayo mheshimiwa ameyataja muhimu sana. Hiyo ndio kitu ya kwanza. Kitu ya pili ni kwamba kitu ya kwanza ambayo nitakaa immediately na Public Service Board ni kuangalia kwamba tuna employ wafanyakazi wa kutosha, kulingana budget ikiwa inaruhusu tuwe na wafanyakazi ambao wataweza kuhudumia. Na kitu cha tatu ni equipment katika hospitali zetu. Siku hizi medical imekuwa digitized, imekuwa ile assistance ambayo daktari inataka kuwa na vifaa vya kisasa vya kufanya diagnosis. Sasa kama hakuna, unakuta wale wagonjwa wanapelekwa huku, wanapelekwa kule kwingine. Kitu kingine ni hizi ambulances ambazo tumesema kwamba nyingi zilinunuliwa wakati ya county, wakati county government ikianza, nyingi zimelala. Ni kwamba lazima tuwe na mipango ya kuzireplace haraka, na pia tufanye ile service pia iweze kufikia mwananchi haraka. Na jambo lingine ni narudia kwa upande wa discipline, ku emphasize on management, wasimamie wafanyakazi vizuri ili waweze kutekeleza kazi zao. Ikiwa hakuna usimamizi mzuri, hata ukiweka vifaa, hata ukijenga jengo nzuri, hata ukipaka rangi pale, kama mfanyakazi hana attitude ile ya kuweza kufanya kazi, lazima tuangalie supervision system to strengthen, ili tuwashike yule ambaye anapewa wajibu anafanya hiyo kazi. Na hiyo ndio mambo ambayo nataka kuyasimamia. Na mwisho kabisa, kama nilivyosema, elimu ya nyanjani ya afya, community health volunteers. Na kama nilivyosema kwamba sote tuko na wajibu, tunatakana tupate kama bill katika national assembly ili tu entrench ile community health volunteer system, iwe tumeisambaza kote, watu waweze kupata elimu ya kuweza kujikinga na magonjwa, si tuongoje mpaka wawe wagonjwa ndio waende hospitali. Nyingi kuna suluhisho tunajua, kwa hivyo ni vile tayari tu kushika mamlaka na kuhakikisha kwamba tunasukuma hii huduma na kumaliza hii kazi. Lakini nina confidence kwamba tutaweza.
Yes, Dr. Peter Marogo Samuel. Thank you very much. We have a couple of questions that we could ask, but because of time, I'll give you an opportunity to give your final submission. But you should understand that most of these members are also board members of a number of health facilities by virtue of their positions. So whatever you are sharing, I think you need to make a very good research, because at some point we informed the committee that level 2 health facilities are supposed to operate 24/7. And you said that when you were young, after you had relocated from Kafloni, where the health facility was Vitengeni Health Center, but relocated to Mijomboni, you used even to go at night to knock and get some services. You should know that if you get an opportunity to the CC Health, the staffs in those health facilities are also human beings. There is nobody who will spend a whole weekend within the facility to wait for a member of the community to knock. Maybe they will even go back to their villages or even travel to other destinations, and they will be back probably on Mondays, because they know that by 8 on Monday they should be at the health facility for health talks and service provision. So at some point, members of the county were listening to you and were following the deliberations. So make a good research in case we get this position, so that you can be in a position to make the right decisions, because members of the public are going to blame you for implying that they will be getting services 24/7, because it is a matter of knocking their door and getting the services. So kindly give your final submissions so that we can...
First of all, I would like to take this opportunity to thank the panel for bearing with me, for listening to me for all that time. I'm not taking this for granted. It's I take it. It's a privilege for me to have an opportunity to serve my county on this particular thing. So, like I have explained in a lot of the responses to the questions that have been asked, the health challenges in Kilifi are many, but they are surmountable, and they are not going to be solved by Peter Marogo alone. This is going to be, when I get this position, it is a coordination and management. The implementation will need partners in this, and this county assembly is going to be one of those partners to be able to drive the health agenda of this country. As for the issues that we've talked about, particularly on the issues of dispensaries, opening hours, I would like to make sure that it doesn't go like my friend was implying. I didn't imply that from tomorrow all the health dispensaries are going to open at over the weekend. But we're saying humanly possible, people should be able to get access to services, and that has been what we say. I say medical is a calling. It's not a profession like a lawyer or an engineer. It's a calling. So when one is called upon to assist, even if they are not on duty on that particular day, somebody has an accident on the road, you don't say, I am not on duty today because the rule says that I work from 8 to 5. People come out and they assist. And that's what we are going to appeal for, human-centered service delivery. That is what we are going I'm talking about here. Thank you very much. Otherwise, I consider myself up to the task. It's challenging, but it's doable with a partnership and collaboration from everyone and very many other departments that need to work with. health doesn't stand alone. You need water, you need agriculture, you need environment to be able to push the agenda forward. And I'm up to the task. Thank you.
Okay, thank you very much. The sergeant will take you through the door so that at least you can pass our warm greetings to the members of the public. And I advise you to get time so that you can pass by the local health facility. Because if I direct you to go back to Vitengeni, maybe it will be hard for you. But at least in Mijombori dispensary, so that at least they can appreciate your presence. You cannot be having such wealth of information and professional, and you fail to even visit your local health facility. And you purport to be a professional, that is your profession.
Yes.
It is good at least members of your village to appreciate you. Even your area MCA is missing you.
I am around.
So maybe you'll get time to meet him so that we can share a few issues about those health facilities around you. Because the other members are not even hoping that maybe you'll get an opportunity to assist them if you fail to even meet those within your village. Wakati mwingine ukumbuke nyumbani bwana.
That's why I'm here.
Sawa, salimia sana kama iko sawa.
Asante sana.
Are you Madam Jane Maiki Kam?
Yes.
Good morning.
Good morning.
Before we proceed, you are supposed to take an oath or affirmation. The officer next to you will guide you.
I, Jane Maiki, Counsel, do solemnly affirm that the information I shall give before this committee of the matters under its consideration shall be the truth, the whole truth, nothing but the truth. Help me God. Okay. I, Jane Maiki Counsel, do swear that the information I shall give before this committee on the matters under its consideration shall be the truth, the whole truth, nothing but the truth, so help me God.
I think from the, take a seat. From the directives, you are supposed to bring all your testimonials and certified copies.
Yes.
You have brought them?
Yes.
Please share them with the officers so that they can go through them. Including your national identity card or the passport. Okay, as we are proceeding, my name is Teddy Mandira, the chairman of the Committee on Appointments. Members are going to introduce themselves. I will take over the vice chair.
Yes, my name is Nikitali Kombo, the deputy chair to this committee.
I'm Thomas Mumbachen, representing the great people of Texas, the minority leader and the member.
Sophia Bidan Church, special elect, a member of this committee.
Agnes Sidi, a member of this committee.
Mheshimiwa Saidi Juma.
Theophilus Alama performed Mzee Rashid
Martha Kokitsiki, representing Marekani Ward, deputy leader of majority and member of this committee.
Deputy Majority Whip, member of this committee.
Yeah, Omar, deputy minority whip, member of this committee.
As the staffs led by the clerk, please.
Michael Ngala, the clerk of the county assembly.
Silas Mulewa, deputy clerk of the county assembly.
William Katana, principal clerk.
And Nyabukadua, clerk to the committee.
Martha George, Hansard director. Rafael Mahona,
Elia Dala, principal clerk assistant.
Omar Chuma, chief sanitary.
Harrison Chizambo, director, Resources.
Rashid Leto, principal legal counsel.
Charles Mapinga, head of finance.
Eileen Chepkemoi, communication officer.
we have a friend in the committee. We have a leader of majority
Yeah.
who is also a member.
Ibrahim Abdi, majority leader, member of this committee.
We also have a friend of the committee. Can introduce himself. Thank you very much. Welcome to the Committee on Appointments, Madam Jen Mike Kamto. There's a document here which you have provided us. If you need clarity. Who is Jen Mike Mkoba?
It's me.
And who is Jenny Mike Kamto?
The same person.
Do you have any document to show that it's the same person?
It's the marriage certificate. In the marriage certificate, I use some cover. In my academic certificates, it's Campton. Yes.
So you don't have any document to show that the Jen Mike Kamto and Jen Mike Mkoba is the same person?
Marriage certificates.
Do you know that it is a requirement? You are supposed to have an affidavit to that effect.
I thought the marriage certificate would stand for.
We are also married, but we are asking about the documentation. This is an official way of handling issues. We are not talking about anybody's husband or wife. Yes. So, are you in a position to provide us with one, if given an opportunity? For instance, if before the end of the day,
Yes.
you can do that.
Yes.
Okay, please do exactly that, because without doing that, then we have difficulties in writing a report about you. We wish to give you an opportunity to inform the committee about yourself, and probably the docket that you have been proposed or nominated. Who is Jen Mike Kamto? Or Jen Mike Mkoba? Who is that?
Thank you so much through the chair. Jen Mike Kamto is a wife. She is a mother of 4. She has been an educationist for the last 26 years. I'm going to consider myself as a community worker. My education background is I'm from the old system, which I did CPE in one of our schools in Kilifi County, at Marekani. And I proceeded
Which
my
school?
Mareni Primary School.
Mareni?
Yes.
Oh, yes.
I proceeded for my secondary education in Nairobi, an Indian school, Uchi Gujarati Hindu Union. It was a girls' school. And after my O-levels, I got the opportunity of being employed with the government dockets at the Attorney General's office as a legal clerk. I worked for 2 years, 1990 and 1991. Due to marital status and being a typical Mijikenda woman, I stopped working and followed my husband to Mombasa. I was a housewife until 1994.
You said due to being a typical Mijikenda. I want to get that aspect so that you know.
Yes, being a typical Mijikenda married woman by then.
A white woman or a lady? Okay, proceed.
I felt I should follow my husband, and because they could not give me a transfer, you can imagine at that age, I decided to stop working, and I joined my husband in Mombasa, and I became a housewife from 1991 to 1994, basically living at Hola, Tana River, and my husband thought, and I also felt, I should go back to class. I went back to college, back in Nairobi, Heritage Teachers College, where I got my P1 certificate. And in 1996, I started teaching in Mombasa. I've been teaching for the last 26 years, as I said before. And by 2006, I was promoted on merit due to performance as a deputy head teacher for 11 years until 2016. I was promoted again on merit due to performance as a head teacher. And from 2016 to date, I've been a head teacher of a school. In between 2004, I went back to class, Kenyatta University. I did a degree of Bachelor of Arts in Education, English Literature. I graduated in 2008. Being still in the fraternity, I joined the Anglican Academy for a certificate in leadership and management, and I graduated in 2010. Went back to class at Kemi in leadership and management for education. I managed to graduate with a diploma. That is Jane Kamto. If I'm going to take anything about my personality, my strength is research and my weakness is curiosity.
So what is your network?
Can I please verify something?
Yes.
Is it network as per Jane Kamto or Jane Mkoba?
You said Jane Mkoba and Jane Kamto are the
Okay,
same,
so
the
as
same
per
person,
Jane,
and you said that you will be providing us with an affidavit before the end of the day.
as per Jane Kamto, I'm worth 2.5. That is I. As per we, I'm worth 75 million, approximate.
We meaning what? You
and my
and Jane Kamto and Jane Mkoba?
Yes.
I want to hear about Jane Kamto.
Jane Kamto.
Jane Kamto and Jane Mkoba, you said they are the same person.
Yes.
We are not talking about Mkoba, because Mkoba is not Jane. We are talking about Jane, Mike Kamto.
Approximate.
For instance, the chairman's wife is different from the chairman. My wife is Mrs. Mwambire, and I'm Mr. Mwambire. So we are talking about that Mrs. We are not talking about Mwambire. Yes, I think you have understood what I mean.
Thank you.
Yes, tell us about Jane Kamto, because Mukoba is not here.
Through the chair, with your permission, I'm worth 2 million.
Made up. Made up of breakdown.
Breakdown of my salary, my shares, and tangible assets, my car.
How much is your account?
1.1.
And the assets? Which other assets?
Salary. It's around a yearly. Okay, I use the word approximate. So okay, maybe another million. 1.1. A few shares with the society, which is around 350. So I'm saying maybe approximately between 2 million to 2.5.
Do you own a school or someone who owns a school?
No, I'm employed.
You don't have a private school?
No.
We'll find out. Okay, thank you very much for giving us that information. We'll be asking more questions as we are going through the form you filled, because I'm just inquiring from the information you provided us with. But I beg to give it to some members. They have a number of questions they want to get responses from you. And I'll start with the Honorable Martha Cox himself.
Thank you so much, Chairman. Madam Jane, now that from your CV, I was going through the CV, you're a teacher by profession, and if this honorable house gives you an opportunity of becoming the CCM, Lands, Energy, Physical Planning, Housing and Urban Development, what professionalism are you bringing from the teaching side
to now this new appointment and new department.
Give me a minute. I just want to- Okay. Through the chair, Honorable Koki, I think from my background, I've been a teacher. As much as I did English literature in university, but social studies has been my area of study for the last 20 years. As much as it's in the lowest capacity of teaching, but I'm in touch with this docket as a subject when I used to teach my children in this particular area. So theoretically, when I talk theoretically, I've come across land problems, land solutions, and they talk about effects, results, and of course when you talk of physical planning, I'm looking at also as a physical features within our vicinity. And what I'm saying, it's theoretically, it has been part of my life. And the other issue I want to put across is this particular department is about our lives today. It's so sensitive, it touches most of the lives of the people. Being a Kilifian, living in Kilifi, I can say I came in touch with the practical or the reality of this domain or this document. Because I'm in it, I'm living it. I'm seeing all the effects, all the things that should have been done differently, but they are done in opposite. And that's why I feel like, in one way or the other, the little knowledge I have, I feel I should contribute to something. And it's not only about I believe this is a docket which is inclusive. It's about outreach to other people. It's about inclusive, it's about teamwork. It's not about me. I can be there making so many suggestions, solutions, but it's also about consultation. So I believe if I consult the right people to get information, I think it can work miracles and we reach our goals. And also, I was looking at the, let me call it a vision and a mission and a manifesto of our current government. There's so much that has been tackled in this area. So whichever direction we are going to take, we must fulfill his vision and mission. And it's not his, it's ours. When as much as we say the manifesto belongs to His Excellency, I look at it in a different way. This manifesto is the people, it belongs to the people of Kilifi. So whichever strategy or a need that has been touched, it has to liaise with us first to fulfill it.
Sure.
Yes.
Yes. Have you seen the manifesto from the government?
Yes.
What does it say about land issues?
Okay. The manifesto of the government touches on the issues of squatters. It touches on effective and functional physical planning. It touches on new technologies on energy, that is clean energy. It touches on land sustainability. It also touches on conservation of land. put more value on land, upgrading our towns, having a good service delivery, and I think that's what I have for now.
So what exactly are you going to do about this protest?
Thank you so much. Through the chair, the squatter issue has been a very sensitive problem in Kilifi. And my thinking is when you talk of the word squatter, it's a term which has been given for the people to be living. But when you look at critically, the percentage of existence of squatter, it's very small. The reality is these people are in their own homes. What they are missing is out of ignorance. What we are missing is the legalization part or security over tenure. That's what is missing. So what we can do is first get the historical background. Why are these particular people squatters in their own homeland? What happened? And of course, getting this information, you have to get it at the grassroots level. You must have a committee which is going to investigate why is Takaungu. People are being told the whole of Takaungu, these people are squatters. But initially when you look at these people, they have been living there for 1 century after the other. Due to historical injustice, we know that is the reason why we are having this issue of squatters all over most of the places in Kilifi. So my take is first, let's do a proper investigation. Why are they squatters? Then we have to liaise with the National Land Commission to come up with a solution, including the Kilifians. I say this is not a suggestion which can be made by an individual. It must be a suggestion which is going to be made by the people who are affected, from the grassroots to the top level. The second issue is, as much as we win, and you're giving back the land to the squatters, you are legalizing, giving them title deeds and all that. There's another issue which is cropping up, and we all know about it. There's the issue of what we call professional squatters. You give them, you allocate land to them, they sell, they go and camp in another land. The same person. But the current modern world, we can digitalize these particular people who are being allocated. Why? For follow-up. In case of another same scenario, you can go into the system and then you see John there. John was there in Takaungu. John is there today in Mariakani. At least there'll be a follow-up to know who is genuinely in need of that land to do something and who is just a professional looking for money. On squatter again, the other issue is as much as we are allocating land back to the people. I'm sorry, maybe I'm coming out of the squatter to add on something else. The leased lands. What happens when the term ends?
Through the chair, I'm still on the squatter. Maybe that one you will give your final submissions on it. You confirm that there are no squatters, just branded as squatters. Remember, you're on live. Don't you see those who are squatters there may feel that now you are given a leeway now to claim this land through any other means? Are you not inciting them now? Then I get in your explanation, you went ahead to confirm that they are professional squatters. So which is which?
I think from my explanation I see that majority they are in their own homeland. They were born there from one generation to the other. What they are missing is the legal document in name of a title. But originally they are the de facto owners of that land. The know-how, when you go you can be given a history. It is my great-great-grandfather who was here. And I added the percentage of squatters is there, but it's minimal in most of our lands in Kilifi. majority, they belong to that land. And then the third classification was now the issue of the professional squatter, which is a fact.
Madam Chair,
Yes.
please relax.
Thank you.
I beg to ask you 3 questions, then we proceed with other questions. What is the work of a county executive member? Who are the county executive members responsible to? And then share the classification of land, if possible. And out of the classifications, tell us the function of the county government on lands, what the county government can do and what the county government cannot do on the land. Kindly share to the committee, because you said you are very good at research and that is your hobby. That is what we told the committee.
Thank you.
Initially. Proceed, please.
Thank you so much, Chairman. Number one, I said it's a hobby, I like researching, it's true. But it depends on the time, what I'm researching. Like yesterday and the other day I was researching about CBC. Today I need to research on land issues.
CBC on land issues?
Yesterday I was researching on CBC. Today...
Yesterday?
Yeah, I'm just giving a good example. As you knew, I was a teacher. So basically, my research was on education. Today here I am, I'm in lands. So I'm on the leeway of researching. And it doesn't mean when you research, it's not that I'm very good. But what I'm saying is I like coming into terms with new ideas. When you research something, you just want to learn. That's what I believe. I just want to learn. That's what I want. And I'm still learning.
Okay, respond to the questions. Don't respond about the research issue.
Okay.
Respond about the 3 questions I have asked so that we can take other questions from members.
The CEC is an implementer, is a policy maker, is an advisor towards the budget in case a need arises, is a solution, not totally solution maker, but a person who can sit and resolve conflicts, either internal or external. He is in charge of, in case of any boundary, land boundary, a CC is also with the county assembly, is also answerable to the county assembly. And what else can I put? A CC is in charge of monitoring whichever plan or project has been approved by the county assembly. For now, I think that's what I can tell.
What about the 3rd question?
What was the 3rd question? Can you remind me, please?
Okay, before I give you the 3rd question, let me just ask the same question in another way. Are you aware of what Article 183 of the Constitution says?
Article?
183 of the Constitution of Kenya.
I'll be honest, no.
You are not aware?
Yes.
Note it somewhere so that after this you can go through it.
Thank you. 183?
Yes. You can go and research.
Thank you.
Okay, give us the classification of land in Kenya and what the county government is responsible and what the national government is responsible for.
Okay.
Because you know land is a shared function as per the Constitution Schedule 4.
Thank you so much, Chairman. We have community land, we have public land, we have private land, and we have leased land. Those are the only 4 classifications I know.
Leased?
leased.
Okay, can inform the committee what each is. I've asked you that question following what you are responding about the issues the two members were asking you. So I wanted to simplify that question. So put it clear so that members can understand. You know, you will be the CC lands. You have not even touched on energy among the other departments. You are talking about land. Yes.
Okay. Community land, it's what I say that the de facto, the land which belongs to generation. It's tulizaliwa hapa ni kwetu. That's what I understand by community land. Public land, it can either belong to the county government or the national government. I see it, according to my understanding, it's the land belongs to the government, whichever government. Private land, I look at it as individual. It can be a group or a person who has bought it from somewhere. Leased land is a land which initially, from history, it's a land which was given to foreigners for a duration of time. And I know most of it is 99 years, in which after that particular time, it's supposed to be taken back to the government. That is the little knowledge I have about this. Yes.
Would you mind to make a research on the same when you're after this?
Yes.
Okay. Okay, Honorable Koki.
Yeah, Madam Jen, land is one very important resource in the world. However, the situation in Kilifi County is a bit worrying when you witness landowners selling big chunks of land at a very cheap price. I would like to know, or I would like you to tell this committee what's your thoughts on the sale. As you write that, we would also like to know as a committee, given the opportunity of being the CC of Lands, Energy, Physical Planning and Urban Development, what would you do in the next 100 days when you're in the office?
Thank you so much, Honorable Koki. What you're saying is true. Through the chair, I've experienced the sale of lands at a very cheap price. A very good example I'm going to give is Chakama. Chakama is a very productive land. It's a virgin land, which from my research, most of it was sold at below the value of that land. I'm talking of 1,000 per acre, which at the end of the day, these are the same people who will claim at the end of the day that they are squatters. Because they have sold all the land, they don't have a compensation, there is nowhere to replace them. They'll still go back and ask for it. The reason why these people are selling this land is because of economical challenges. It's because of the poverty line which the Kilifians are in. As a CEC, we must give them a purpose. If we don't give them a purpose, they'll keep on selling. Why am I saying a purpose? I mean a purpose. I'm going to take an example of initially about settlement schemes. From my little knowledge that I have, every settlement scheme, it was, by the way, started by the colonial government. And the reason was to empower economical stability. And settlement schemes were given with a reason. It was not just residential. So whichever settlement scheme was established, there was an economical activity attached to that particular scheme. This is not a scheme, it's freehold land. It's ownership. But as a government, let's give them a purpose. I believe if we had give a visit to Chakama as a government. Look at the land, see the valuation of the land, see the resources that are in that land. We could have come up with a very capable economical plan. If a land is virgin, even the trees are valuable. They are very valuable. If we decide this one we are going to make a certain project, we want to eradicate or we want to get rid of these indigenous trees, we must have a plan. But at the end of the day, whichever plan we come up with, it should benefit the local. For the reason why they should not sell their land. If we put that land into use, that's what I'm saying, economically, nobody will have a reason to sell. Because this is the only earn I have, and I need the money. Nisipouza, I'll even die of hunger. This is the only source I can educate my children. Those are the major reasons which make these people sell their land. So let's give them a purpose, a reason not to sell. And this is not, it has to be, we must have a committee, come up with different ideas. As much as people say we are the policy makers, but it's through consultation. It's through things that are affecting the people. The policy should be directed to the needs of the people. So I believe if we were fast enough at Chakama, today we wouldn't have lost that land. If we had initiated some projects, if you had gone there and say, let's do a settlement scheme here, let's start planting this and this, we won't have such a scenario. So my take is, let's come with economical stability programs. The second one, 100 days. Sorry.
Okay, proceed.
Within 100 days in the office, it's a request through your approval, because I know I need the approval of the county assembly. We should do an audit, land audit, within 100 days, to know exactly what we are facing. The grabbed land, the settlement schemes that we have, the sold land, the etc. I think for 100 days it will be, we should know where we want to start. First, let's know what do we have in hand. When we talk of land, which is this land located? These 3.1 hectares, are they still there? What belongs to the public? How many acres belong to the community? How much land the lease has ended and it has taken back to the government? What was the decision made by the government? Was it sold again or was it given back to the community? I think that's what I mean by auditing.
Okay, Honorable Sid.
Thank you, Mr. Chair. Jen, how are you?
I'm fine.
It's a pleasure to meet you. I have two questions. The first one will be, how do you intend to deal with the question of the absentee landlords? And then the next question is, we've witnessed the power outages. We've witnessed a power outage in the county. And this affects households and businesses at the same time. It is in your portfolio, you're in charge of it. So what are you going to do about the power outages in the county?
Yes, please add.
Madam Jane.
Yes.
I hope you've heard about the land valuation board.
Land valuation?
Board. You've heard about it?
I've heard about valuation.
Your department plays a major role on our own source review as well. I don't know whether you know that. And all along we have been having an issue on approval of that land evaluation board. Because people are claiming, those from the town centers, they are paying high rates. So I don't know how you're going to handle that. I don't know what you can commit before this committee here on how you're going to solve that. Secondly, we have the old housing scheme under the former national government. Now, after the transition, some were transferred to the counties. You've heard about the Ngala estates in Kilifi and other housing that are around it. They have been in the local state since then to date. And this is also a way of raising our own source revenue. I remember last time there was a plan to demolish all those old houses and build new houses, like what is happening in Mombasa, Pakistan. But due to political influence and other factors, that was not implemented. You, if given that opportunity, do you think you'll have the shocks to resist all those forces and implement this?
Thank you so much through the chair. The question of absentee landlords. I know it's vibrant in Kilifi, and that is the reason why it's leading to the existence of squatters, because they are being seen as views and empty land anybody will want to occupy. According to the Constitution 2012, which let me just be saying I'm not very sure, there is this directive, or it was a policy, that within 12 years, if the land owner is not seen, the people who are occupying that particular land should be considered as the owner. I don't know whether it was approved or not, but if this particular act was approved, and following the procedure of our constitution, then I'm not seeing any problem. An absentee landlord, after all, if this person was occupying your land for 12 years, that means this person has been your caretaker. He's been taking care of your land. So when you come after 12 years,
You know, we expect the questions shared to you to get response. It is becoming a big challenge to us if we ask back, if we ask the panel now to respond to you. We are even wondering.
it's the teacher in me, sorry.
Did you understand the question? Because out of all the questions we have asked, we are having challenges with most of the responses we have given, regardless of being a teacher. So I don't know whether you don't understand the type of questions we are asking.
Okay, let me try to understand that. Thank you.
We are silent because we want to give you an ample time to give the best responses that you can get. Yes, from your research.
Okay. Absent landlords, as I'm putting it, is according to the law, they are not supposed to claim the land.
No, let the honorable member ask that question again, please.
Please repeat.
I think it's me.
It's
madam. Yeah, I
So that
think
you can know.
what I said is how do you intend to deal with the question of absentee landlords?
Thank you. The response will be first to involve a committee in case of such a conflict comes up. Do a background check-up on how long has this particular landlord been absent, and then we look at the law, what the law says, And of course, there must be a dialogue or a negotiation between the two parties. Yes. Thank you. The second question to the chair was about the power fluctuation. Outrage. Currently, we are talking of clean energy, where we are being advised and encouraged to find other ways of getting power apart from the normal electricity which was introduced all along. As a CC, I'm going to research on the new technologies of clean energy and encourage types of energy to be used, such as solars, use of biogas, and use of also green energy, with a proper research and the expertise from the people who are involved in this docket. I want to make good use of them so that they can advise us and sensitize us on how we can go to reduce the power fluctuation.
Madam Chair.
Yes.
What plans do you have for the housing department in the county?
Yes, there was that question on Gala Estate. On housing department, first, can I answer on the rates? There was a question
Just
on
proceed,
the rates.
because they all lie in that. So just coin it.
There was the question of physical, the question of rates.
I talked about land valuation law, which now stipulates how the land should be categorized in payment of rents and rent. There's rent, there's rent.
Okay. I'm looking at it on the question of rates. There's a reason why we pay rates as landowners. We expect what is called service delivery. We are expecting when we pay the rates, we are going to get services as garbage collection, security services, street lights from our government. And I'm seeing from research, as I said, I did research. The land rates which are being paid right now is 15%. And for me...
Chair, yes. I think I don't think we deliberate more on the money that is paid as rent or rent. The issue is the evaluation role itself has issues. How are you going to solve that? Because for it not to be implemented, it has to be passed by the Assembly.
Yes.
That's why I started by asking you, do you know about it?
I've heard about it.
But you don't know about it. Now you can move to the next question. You can finish the my last question.
About housing, from my knowledge, when I talk of the government housing, county government housing, we only have houses in Kilifi and Malindi, which is Ngala Estate. And
there are also others in Marafa and many others. Just address the issue.
Thank you. This is what I know at least. And I know they are not in good condition. And I'm a witness of how they used to be long time ago. It was a beautiful estate, well established, well planned. And I think we should go back. There was a master plan on this. And I think the reason why they're in that state, we came out of the master plan. We have to go back to the blueprint, look at the plan. How was it supposed to be? What was the duration of maintenance and repair, which was initially requested? By doing that, we'll be in a position to redevelop them. I don't believe in demolition because old is gold. The current housing we are doing right now, you cannot compare them with the old structures. But also it depends. If it has deteriorated to a point where we need to demolish, it's something which we have to agree with the county assembly. It has to be budgeted. And if it is maintenance and repair, it is something also which has to be agreed.
Yeah, have you ever stepped into one of the houses?
When they were new. When they were new. That I'm talking of long time ago. I've been to Ngala Estate in Malindi.
What I was asking is, you see, there was even some time back, there were even letters that they should vacate the houses, so that the government now can rebuild new and modern houses. But due to political pressure, that could not be done. That's why I asked you, are you in a position now to sustain that pressure and allow that thing done if you're being given that position?
If it is a need that is going to benefit the people and increase the rates to our revenue, I believe I can be in a position to, and I will.
Okay.
What do you know about urban development in Kilifi County? How many municipalities do you have, and how many are you intending to increase within the line of the law?
Thank you so much. Through the chair, I believe right now we have 2 municipalities, Malindi and Kilifi. And there's a proposal that Mariakani has to be a municipality, and I think I'm not so sure on how many towns are supposed to be upgraded as municipality. And what I know about Malindi and Kilifi as being municipalities, it's they need to be redeveloped and put the right structures in place to upgrade it. I believe they also need to be given title deeds so that they can be in a position to pay the rates. That's the minimum.
Okay, thank you. Do you have a questionnaire with you? The questionnaire you shared with us. Maybe you can be assisted. So make sure that she has a copy so that we can want to wind up. She has said she's a very good researcher. I want to see if we can assist each other. Give her a copy of the questionnaire, please. Let's go to number 4 of 8.
Number?
4 of 8. That is number 19. The questions you are supposed to assist us with. You are at number 19. Read B.
Yes.
Is that the position?
Okay, supply 4 copies of any reports, memorandum, or policy statements you prepared or contributed in the preparation of any bar association, committee, conference, or organization of which you are a member.
You have not done that. Or does anything you ever prepared in your life?
I think I found it a bit tricky to answer this. It's, when I read A, when you talk of publish,
A was about publishing.
no, I've not done any policies. At my level, I haven't.
Have you ever been into any position at Ketro?
I'm a member.
You are a member? Okay. Na hii inaitwa mafanikio sako?
I'm also a member.
That's a member. You have done nothing you have written nothing, you have never researched on anything. You said you are a researcher, that's why I wanted to know if you have gone to that level. Okay, let's go to 20. Number 20 now. That was 19. You have been to public offices.
Yes.
Let's go to A. You have told the committee that you worked in the AG's office as a clerk. Then thereafter you went, as a Mijikenda lady or a woman, you felt if the man will be in Mombasa and you are in Nairobi, you might be substituted, so you resigned. You resigned, you came to Mombasa, and later on you went back to Nairobi College. You became a teacher. You were promoted by merit to be a deputy head teacher. You were promoted again on merit to be head teacher. Read what you are supposed to have done, and if the response is okay with you, because I think there's some information which is missing somewhere.
This chronologically, any public office you have held or are currently holding, including the terms of service, and whether such positions were elected or appointed. I missed something.
You missed?
Yeah.
You can inform the committee. For me, I don't know. You are the one who knows. Inform the committee what you
I
missed.
was working at the Attorney General as a legal clerk based on birth and the date. And I've been a teacher, still in public office. And I've always worked with the public office. And where I am today, I'm still working with the public office.
Does the space adequate to write all that, or because it appears you are very economical? Or you did not understand the question, because from the papers you have provided us here, it appears that you did English literature. True?
Yes.
What might be the reason?
Tension.
And you said you normally do research.
Tension.
How many days were you given to respond to this question?
In fact, the day you gave us, it's even you created more tension.
So how many days were you supposed to?
Is it a week?
It was a week.
It's a week, yeah.
Oh, so you got some counseling. So after counseling is when you responded to this. You gave this response.
I wish I had some counseling. Maybe I could have responded better.
Okay. Okay. We understand you. We are very happy that we have had time with you, Madam Jane Mike Kamto, or Madam Jane Mike Mkoba. We really appreciate your time and even the way you have responded to our worthy questions. I believe by now members of this committee and even the public who have been following, they are aware of the type of CC who have been proposed to take up that position. So we would wish to give you time to give your final submissions so that at least we can end the conversation. Would you mind to give us your final submission?
First, let me start by thanking you for giving me this opportunity to listen to my understanding as per my level. I also want to thank the governor for nominating me in this position. And as nervous as I was, which I will not pretend I wasn't, let me appreciate the guideline that you have given me. And I hope and believe I'll be part of this team, because I don't believe in working as an individual. I believe in teamwork. At the end of the day, it's going to be inclusive. I'll need you as much as you will need me. And I believe together, if we put our heads down, we can come with a good solution for our society. My take is maybe after the duration which I'll be in, I want to see a society which is self-reliant in all this. Thank you.
Okay, thank you very much, Madam Kamto. Sergeant Agam will escort you. Don't forget to bring the document you promised the committee that we bring before the end of the day. I really wish you all the best. Pass a warm greetings to all your family members, friends and networks. I think you have a story to tell about the county assembly. It is very welcoming, understanding. Name it and we have it. May God bless you.
Thank you so much.
Yes, take your seat, please. How are you? Kindly take a seat. Okay. Welcome to the Committee on Appointments. The first step before we even proceed, you are supposed to take an oath or an affirmation. The officer next to you will guide you through this.
Do swear that the information I shall give before this committee on the matters under its consideration shall be the truth, the whole truth, nothing but the truth. So help me God.
Allow me to understand you. You said the two names. And it appears you have three names. Are you not Clara Ngonge Chong?
Yes.
Ngome Chong?
Yes. I am.
So who is that? Do you have an affidavit to claim that it is the same person?
It's the same person. I can use the three names.
Then I think you have to check with your own.
I, Clara Ngome Chonga, do swear that the information I shall give before this committee on the matters under its consideration shall be the truth, the whole truth, nothing but the truth. So help me God.
And the communication you are told to bring your original testimonials and certified copies. Have you done so?
Yes.
Okay. Allow us to go through them so that we can confirm whether you have complied with that. Okay, welcome. My name is Teddy Mbao Mandira. I'm the chairman of this committee on appointment for the Great County Assembly of Kilifi. Other members will introduce themselves, starting with my vice chair. Please proceed.
My name is Teddy Mbao, deputy chair of this committee. Welcome.
Thomas Mumbashambo, minority leader and member of this committee.
I'm Sophia Abdullahi Chacha, special elect member of this committee.
Agnes Sidi, member of this committee.
Mheshimiwa Theophilus Alama Kwanza, Alisia Darasa, David Senior Speaker, member of this committee.
Martha Folk Kimsioki, MCA Mayakani Ward, Deputy Leader of Majority and a member of this committee.
Lawyer Abdul Karim, Deputy Majority Whip, member of this committee.
Araria Ali Omar, Deputy Minority Whip, member of this committee.
Introduce yourself, please.
Ibrahim Abdurrahman, Majority Leader, member of this committee.
Okay, the staffs please led by the Deputy Clerk.
Silas Mulewa, Deputy Clerk.
William Katana, Principal Clerk.
Nyavukagua, Clerk to the committee.
Martha George, Answer Director. Rafael Rimba, Communication. Chief Sergeant Attorney.
Lilian Ngala, Principal Clerk.
Yes, proceed please.
Charles Makira, Head of Finance. Alvin Chizambo, Director Human Resource Administration.
Secretary, Head of Research.
Damaris Safari, Public Relations Officer. Irene Chepkemoi, Communication Officer.
Oh. Madam Clara Ngome Chonga, we wish to know you. So, but there are some documents which we are yet to confirm from you. Do you have a DCI clearance certificate?
It was not out, so I have attached the receipt.
Where is the receipt? CRP? You have it?
Please listen to this.
have a clearance certificate or a credit report?
That's what I was given by
I know you are learned. You know the difference between a clearance and a certificate?
Yes, I know.
So what were you given?
I asked them and that's what they gave me.
No, I'm asking, what were you given?
A report.
What were you supposed to bring? You are supposed to bring a certificate of good conduct from the Criminal Investigation Department and a certificate from the Credit Reference Bureau. You understand English?
Yes.
Ordinary English?
Yes.
Or Queen's language? Ah, okay. So, what were you provided? This is tax. So how can we get that document?
Unless I bring it on Friday, because, okay, to be honest, I've never been asked anywhere for this thing, so when they gave me, I just thought this was the right document I was given, because I have never seen it myself, I have never used it anywhere, so when I was given, I thought that is the right document.
Was it written certificate? Because I think the directive that you bring a certificate. What was the name of the document you were given, which you are convinced that it might be that?
It's not attached there.
Sasa wewe utakuwa waziri wa elimu na unashindwa kutoa certificate na kuchukua barua. Unachukua recommendation letter badala certificate. Sasa ile nafasi yako ni ya waziri wa elimu. Recommendation letter na certificate within tofauti. Kwa mfano.
And I've explained to you that it's something I've never had. So if a government official gives you that document, you take it that it's the true document he has given you. And I've never seen a copy.
Okay. Do you have an accreditation for the MBA from Australia?
With that one, I could not get it.
Why?
They never communicated. I tried communicating. I even have emails here, and I could not get it. And because I was told in your requirement is the first degree, I attached the first degree, which is Kenyan, and the Australian degree has an accreditation from the Ministry of Education in Australia.
Not the Commission for Higher Education?
I could not get through them at all, and I have emailed for support for that.
What about the certificate you want? When can you bring it? Because the certificate, you brought another letter, we want a certificate. When can you bring it?
For the higher education?
No. CRB.
Okay, I can go back to Huduma on Friday.
So you'll provide that document on Friday after?
Yes.
Okay, don't think that we are taking it lightly. It is a requirement in this committee.
Because tomorrow is a public holiday, so I cannot go there. But on Friday morning I'll be there and I bring it here on Thursday.
Please make sure you bring even the certificate of good conduct on Friday afternoon. Bring all these documents, because we are not going to write a report about you without getting these documents. They are very essential. And you know the report is supposed to be tabled at the county assembly. So as a committee, we will not have done justice to the county assembly. So we are not going to appreciate a receipt. You might be dealing with a criminal. So unless they say you are good and all those things, it will be okay.
According to my understanding, I knew that Chapter 6 had been removed from employment. That's why I did
Chapter
not...
6?
Yes.
Imeondolewa?
What of kazi wanapoa, they don't need that.
Lakini si umeandika ulete, siku hata haitakikani, lazima ujulikane mtu aina gani. Can we take you to a public service without knowing your credibility? It is not impossible. That's why you asked even about your network.
Enlighten us on this to the chair. So this the issue of Chapter 6 removed from someone seeking a public appointment.
Yeah, because I was saying that it's too expensive for people to get all those certificates when you are seeking for employment. When you're seeking for employment, obviously you don't have money. So you cannot use money to look for money.
Is that the reason you didn't attach yours?
No. The reason is because it takes, I think, they told me 2.5 weeks.
The clearance for higher loans board is the one which we as members of parliament said that it should be removed because you are supposed to have cleared all your fees and even the loans. So some of the young people who wanted to get to access to employment had issues. That's why they were saying they should not go for that. But you should be cleared. You should know your criminal records. You cannot just come in and say that I'm young, so I should be employed. There's no need for you to know my net worth or what. We might end up employing crooks, if that is the case. So it is there. So if you get this opportunity, don't lie to our young kids, and even those who will be in the professional training centers, don't lie to them. They should comply with whatever is required. Even us, when we are looking for the positions we are in, we have to provide this information. You know the reason why? We are going to deal with the public, and the public needs somebody who has the required integrity. So tell us about you, but you make sure that tomorrow, on Friday by noon, you should provide this document to the county assembly. Yes. The other stories, they will be underwater. So they'll be here. If they'll not be here, then we will excuse us. We are going to give them leeway with the master's degree. We are not going to consider it because we need to get a letter to confirm it. So as we are writing, we'll write that we have a first aid. Kindly tell us about you. Sorry, it was just part of introduction.
My name is Clara Chonga. Born in Mombasa, raised in Kilifi. A mother, a wife, and a mother of 2. Education.
Would you be kind enough to inform us those parts? Because in Mombasa you can be at Shimoloteo,
Mombasa.
You can be at Mikindani, Likoni.
Okay, I was born in Mary Grid Hospital, Mombasa.
Kilifi.
Yes.
You said in Kilifi. Which part of Kilifi?
Where I stay in Kilifi.
Give us make us understand you, to know
Okay,
you.
I live in Kilifi.
You were born in Mombasa.
Born in Mombasa, then our family moved to Kilifi.
Yes, which part of Kilifi? Because we are currently in Kilifi. Malinde is Kilifi.
Yes. Mtondia Tezo.
Proceed now.
Yeah. So from there I went to school to St. Thomas Academy, then to Ribe Girls. After Ribe Girls I went to USIU.
Would you mind to share the years? We might trust your classmates.
Okay, I cleared St. Thomas in 1996. From 1997 to 2000 I was in Ribe Girls Secondary School. And from then I took a gap year, joined in 2 years, joined university in 2002 September in USIU and pursued Bachelor of Science in International Business Administration, Finance Option. I also did some review of CPA, Section 2 and Section 2. And after that, I got a job at, I interned at Cambridge Wellcome Trust for 4 months, 2005, September to December. From there, I went to Insco Kenya Limited, where I worked as a branch accountant from 2006. From 2006, I worked at Insco Kenya Limited as a branch accountant for the branches of Insco Kenya Limited, Union Towers, Westlands, and Waiaki.
So you said you worked at Camp for how many?
Camp was internship for 4 months, from September to December.
Thereafter,
Insco Kenya Limited.
that is private.
Yes, a private company.
Okay.
Continue.
Continue. We are listening to you.
From Insco Kenya Limited, and then I took some little break where I started doing SCCA, then left and came to Kimawasco in Kilifi, where I worked as a financial accountant. And I left Kimawasco in 2011 March, because I had to leave the country. My husband had been expatriated to Mozambique and we had to live as a family. So in Mozambique, I was not working. I became a full-time mother. I took motherhood as a career, brought up my 2 children in Mozambique, and did mostly, they speak Portuguese, so I was doing the language, learning Portuguese language, and yeah, helping out here and there. After that, we moved again to Papua New Guinea in Oceania, where I pursued my master's now, because my kids were big enough to attend school, so I had time for myself, and I used that time to do my double master's in business administration and master's in professional accounting.
Just members wish to know, why was your husband repatriated? Because you said you are
expatriated.
Oh, okay.
Yeah. He's Kenyan.
Do you have your questionnaire? There's a questionnaire which you filled. Do you have a copy with you?
No.
Assist her to get a copy so that at least we can share What is your net worth as you are proceeding to that? So the other question I wanted you to look into that.
40 million.
You can share the breakdown?
The breakdown, a house, a car, and a plot.
A house where? And the plot where?
A house in Vipingo, and a car, and a plot and some little cash.
Okay, that's great. Now let's go to page 5 of 8. Oh, you are there?
Yes.
You have seen question number 20.
Yes.
I've seen question number 20. It's on page 4 of 8. If you go to page 5 of 8A, you got an opportunity to read that question.
Yes.
Was that an appropriate response to the question? You can read it so that members can
List
understand.
chronologically any public offices you have held or are currently holding, including the terms of service and whether such positions were elected or appointed.
Was that the appropriate? What was the response you gave to the committee?
Not available, not appropriate.
Is that the position?
I think so, because there's another question which I answered the same.
No, I'm asking about this question. Was that the appropriate response?
Yes.
Or you did not understand?
I understood, because A is in response to, I'm hoping this on page 4, it has subtopic, public office, political activities and affiliations.
So, public office. Kimawasco was not a public office.
It is, that's what I'm saying. There's a question which was answered, so I thought this was mostly related to
This
the
is number 20. Number 20A. Number 20, the main question is public office, political activities, and affiliation. A, list chronologically any public offices you have held or have currently, or you are currently holding, including the terms of service and whether such positions were elected or appointed. You said not applicable.
Madam, was that, do you think that was the right response to that question?
Okay, according to me, at that time, they were understood it. That was the right position.
That time. What about now that you are seated there and you are inquiring?
Okay, maybe I'll list the Kimawasco under this, but that my understanding at that particular time, I thought it did not fit here.
You know, we are listening to you. As I thought that now, we want to know the right position about this response. Because we asked about yourself. You told us who you are, where you have been, and we went back to the responses you gave. That's why we are inquiring to know whether this is still the position or what.
Okay, I'd say I work for Kimawasco.
Is Kimawasco a public office?
Yes.
In fact, before that you did your internship at Cambridge. Is Cambridge a public office?
Yes.
So you do not acknowledge those as public officers. Was it by design or did not understand?
Maybe also I did not understand because there's another question which I asked about the same and I...
Which question? This is question number 20. I think you are someone who got an opportunity to even deal with different languages.
Yeah, page 2, question 15.
No, we are talking about question 20. We are talking about question 20 of the questionnaire. We are looking at the responses you gave in question 20 of the questionnaire. How do you relate question 2 and question 20?
Not question 2, question 15.
How do you relate question 15 and question 20?
Question 15.
Because I think each question required its own response, independent response. So when you are marking, for instance, when a teacher is marking, anakupatia marks hii ya 20 kwa sababu hivi kulikuwa umepata ile nyingine ya 15. Nasema hii 15 alipata, hata yeye hakuna haja ya kuuliza, weka tu marks ya sawa. Atafanya hivyo mwalimu? Sasa mbona madamu nataka kuchanganya kamati? Si tueleze, mimi swali yangu ilikuwa rahisi, nimekuuliza hili jibu ulipeana, ndio bado nimebaki hilo ama una mabadiliko ili tukuelewe tu hapo peke yake?
No, nimesema kuna mabadiliko because I've lived Kimawasco as a public office.
Hata Cambridge ulipitia?
Yes.
Sasa elezea vizuri kamati ili waelewe. Kama pengine kutumia lugha ya Kimombo inakuwa shida, tunaweza geuza hata Kichonyi pia ili hakikisha kama mambo yanakuwa sawa. Ama Kikongolese. Tuendelee. Waeleza kamati ili wafahamu vizuri.
Okay, maybe it was an oversight on my side and...
You said, you know, if you say maybe, it is as if you are talking on behalf of someone.
Okay, I'll
the
say
committee is dealing with Clara Ngome Chonga. So I want to hear from Clara Ngome Chonga's position. Just assist us to talk about the Clara Ngome Chonga, if you are the one.
I would say it was an oversight on my side.
So what do you recommend to the committee about that?
I recommend that they accept that, yes, I worked in a public office.
Okay, the committee have noted. Okay, we can proceed with other questions. Honorable Sophie, inquires we are going through what she gave, so that as she is talking, we will make reference.
Good afternoon, Miss Clara.
Good afternoon.
Just relax. We are just here performing our duties, nothing personal. I guess since you got the nomination, you've been doing some thorough research.
Yes.
On the docket that you might be the CEC. I just want to know if you've seen the state of the rural schools in Kilifi County.
Yes.
Well, my question is, why do we have most schools almost collapsing while the county government on every financial year allocates funds towards that department? And then lastly, what is your take on CBC? Thank you.
Okay, first question, why most schools are collapsing, I would say it's the resources are not allocated to the rightful places. One, the county government builds schools, but maintenance is on the school itself. So if a school does not budget for maintenance, no matter how good the buildings will be, then their school will automatically collapse. So it's the school management itself, the board members, to allocate money for the maintenance, because the county will build nice classes, but if they are not well maintained and there's no budget for that, they will automatically collapse.
So how are you planning to, through the chair, planning to stop that or look into it?
Yeah. My plan will be to engage the board members, the school management, and the parents, because I, as a parent, if I come to a school and I look at the buildings, if they are not good, I will not obviously take my kids to that school. Even if he had been sent to the school, I will not take, because one, you will not want your kid to learn in such situation. So the best thing is to engage the board members and help them in budgeting the money they have, so that some can go to maintenance. And also this, you even help them advise on procurement, because sometimes we ignore so many little things thinking that they're expensive, and we go for cheap things which you keep doing every year. Like some people have to paint every year because you are getting some cheap paint, or we are not getting a professional in painting. We just get someone who is there like, okay, this one can paint because he's our neighbor, let's give him the job to paint, and he does a poor job, and you, at the end, you pay him the same amount you would have paid a professional, and you still have to do the job every year. So the best is to advise them first to get quality products, budget, put the maintenance on budget, and get professionals in dealing with the work. My take on CBC, CBC is a good program, but the only limitation is that it is underfunded, and second, people are not trained on it. When I compare CBC to the international curriculum, it is one and the same. The only difference is that the international curriculum, they are well funded, their teachers are well trained, and they have the materials and facilities. When you tell kids to count, in international schools, they'll have the counters in different colors and materials. So even when you are learning, you are teaching them about sensory, touch, and everything. Like you can have a toy, you are using counters, which is red. So at the same time you are counting, but they're also learning colors. Like, can you count all the red blocks? When you come to CBC, people are using bottle tops, or stones, or sticks, you know.
That's what they can afford.
Break sticks on. Everyone come with 10 sticks and you use it as counters. So what are you teaching these people? Sticks.
Yes, yes.
A follow-up question. You know the mandate of county government on education?
Yes.
Kindly enlighten us on that.
Okay, the county government, what was devolved to the county is the pre-primary and the vocational training. So the mandate is for them to provide, to build the structures for pre-primary, provide teachers and pay them, and the VTCs too.
Okay, we go back to the CBC. This being the first year of having a junior secondary, what is your take on the World Scholarship Fund that is currently in place? Because we'll be having junior secondary going to high school, and we'll be having the class 8 going to high school. So we are expecting the demand to be more. So what is your take in this?
Okay, my take is that the junior secondary school fees are not as high as the other secondary school, because most of it will still be in, most junior secondary schools will be still maintained in the primary schools. They are not being moved. the kids are not being moved as such, because most of them will still be in the same schools. Some schools already have facilities for the junior secondary school. So their intake for scholarship will not be as high as the other one. And I don't think many schools are going to change things like uniform or other things which are needed as in secondary school, where in short, mostly they are day schools, where you don't need boarding facilities, so that already brings the cost down. Secondly, we just need to sensitize parents on the available options. We don't only have ward scholarships. There are so many scholarships available from Equity, Family Bank, and other.
With the current World Scholarship Fund that we have, what are you intending to do with this? This being the first time that we are having in the country, like we are having junior secondary. You get my question?
Yes.
The price and the expenses is not an issue here. The issue is now the demand will be too high. We'll be having students going to high school, class 8 students, and we'll be having students who are going to high school, a junior secondary. So we are expecting a high demand because by the virtue that we are living in poverty high level in our county, so many parents are expecting to get support from the county World Scholarship Fund. So what is your take in this?
Okay, that's why maybe you didn't get my answer. I said most junior school, people who be going to junior school are not moving schools. Most of them are not moving schools. Yeah, correct?
That's it.
Yeah, so even their intake, their budget will already be small. That's one thing. So if you need to shift a small amount of budget from the World Scholarship, which mostly funds the high school and the tertiary college era, it should be a very minimal amount which will go to the junior secondary school. Because already these schools, they will not need new uniform, transport will be the same to their school, most of their intakes will be the same, they are sort of fixed. So they will not need that much funding.
So you think the current allocation will be okay?
Yes, you just have to proportionate that this amount will go to the ward, and also this will be on need basis. When you are budgeting on the needs, which are already there and none.
Chair.
Yes, Honorable.
Clara Johnson, congratulations on your nomination. I would want to ask, what do you feel? Do you feel if it is necessary to have feeding program for our ECD schools within our county? And then another thing would be, I'll ask you two questions. There's a gap between skills acquired through our vocational centers. I have visited a few of them and I have seen what those young people are really doing there. But there's this bridge between them having very good things that they are making, but the opportunities or market for what they are doing. What interventions will you put in place when given this opportunity to work as our wazir? The first one, I asked you, do you feel it's necessary to have a school feeding program for our kids?
Yes, on that feeding program, it is very essential because most of these kids do not have proper nutrition at home. Some don't even get breakfast, or some depend on only one meal, and mostly it's taken in the evening after parents come back from their daily labors. So having kids on proper diet will ensure that they are constantly in school. They do not miss school. What does that mean? That means that even their performance will go up, their health will improve, and they will not be in hospital. Absenteeism will be reduced. And this is not just feeding, they need with the proper meal for the young kids. Yeah. Now, on the gap on the skills, Yes, there is a very big gap because naturally we human beings tend to think that the vocational schools are of low grade, that I cannot go there and even buy the furniture they are making, yet you are the ones who are funding them. Just example, the seat you are sitting on will go to another company to fund us seats, but you cannot go to them because we just think they are of low quality. And what do you think because of low quality? Because their syllabus, I think, has not changed for so long. They keep repeating, they're doing the same thing. You find that Taylor has been doing the same thing. He has never been upgraded to designing so that her products can look good. The carpenter just smoothens the wood and makes the same type of chair for so long. So normally as a human being, we love good things, and I would say, no, I cannot take such thing. So for me, my plan is to make sure, first of all, that we have skilled teachers, and also to change the syllabus so that it can be upgraded to fit with the current needs. We cannot use an old syllabus which was put a long time ago, 20 years back, and things have changed.
Yes. Good afternoon. So maybe if I should understand, what is your vision for this school?
Vision for?
For being the CC.
Oh,
what do you envision?
My vision is to provide quality education for everyone.
How will you go about it?
How will I go about it? First of all, I was happy to learn that the county has started building modern, what they call modern classes for the ECDs and even the VTCs, which is a really good idea. I haven't seen how modern it is, but yeah, I have ideas of how a modern class should be. I would say I'm privileged to have traveled around and have seen different systems of how modern classes are in different countries and also in Kenya, and my plan is to incorporate them here so that we give these people, ECD is most basically learning and play, so they should have fun while learning, and that will motivate them even to move to the next class.
Maybe Madam Clara.
Yes.
How many model ECDs do we have in Kilifi County? And how many vocational training centers do we have in the county?
Vocational centers, I know there are 41. And the ECDs, there are 700, around 750.
The model?
Oh, the new model.
I'm asking about model ECD center. There's a book there and a pen. You can be writing the questions.
Okay. Model ECD centers.
My questions were two. One, how many model ECD centers do we have in Kilifi County? Two, how many vocational training centers do we have in our county?
Okay, vocational training centers, there are 41. I understand 38 are operational and 3 are not operational because they are not registered.
Which ones are not operational?
And there's one in Malindi.
Which one? Which one in Malindi? If you're not sure, tell us you're not sure, because you said
The
you
name
think...
just slipped off, but I know there's one in Malindi and one in Jundu, and I've forgotten the other one, but I know there are 3 which are not registered, so they're not operational, but in total there are 41.
Okay. Tell us about the ECD center, the model.
The model ones, there are 400 and I think 430.
Model ECD centers in Kilifi County. 430. How many courses do we offer in the vocational training centers, in our vocational training centers?
That I'm not sure.
Average. Because you talked about the chairs we have seated on and referred us with those being made by the students in vocational training centers, which means you have clear information of what is happening.
No, I know for a VTC center to be operational, they have to have at least 3 courses. And these courses are not...
Which are they?
any. You know, they're not specific that every vocational center must have that. The needs are different in every
You
place.
don't know even the courses which are being offered in a vocational
I
center.
know. Hairdressing.
I've asked you to share with the committee.
Okay, I know about hairdressing, tailoring, woodwork, electrical and wiring, plumbing. Yeah, carpentry.
You said woodwork and carpentry. I had woodwork before.
Carpentry is general.
Okay.
On the woodworks.
Oh. Yes, Honorable Nyare Kombo.
Mine would be to ask you if you know the functions of the county assembly.
Yes, some I know.
Yeah, can you tell us?
One of them is what is going on right now, vetting of CDCs. The other one is formulating those for the county assembly.
Maybe to be clear, so the county assembly's role, first role to vet CCs only?
No. I just said one of them.
You said one of them
Yeah.
is to vet CCs.
Yeah.
So what about the other officers in the county?
No, I said one of them is vetting, like what is happening right now, vetting of CDCs.
What other officers are also subjected to vetting? You're not sure? That is the reason why I was asking that supplementary question. Proceed.
So, you know, only three functions of the county assembly. What does your MCA do in the county assembly for you?
They also initiate projects.
Who is your MC? Do you know the name of your MC?
Thomas Chango.
Thomas Chango is your MC. Honorable Chango, ask any question to him. Ask any question.
How are you? Good to see you.
Honorable Fondo, please. Ask the questions.
How would you engage the public in delivering your service when appointed? That's the question of CC education.
Mostly in participatory engagement. I would put them in two groups, with the corporates and the normal minority, where all have to be involved. You participate in the, for example, when you're building the ECDs or when you're equipping them, the companies and corporates you can ask for help with some sort of donations. Like we know companies mostly when they are upgrading their system, they give out their computer system, they give out their furniture and all. So we can engage them to donate, and also the public can come in and donate money or whatever.
What about public participation?
I said public participation, the first thing.
You know the functions, through the chair, so what are the functions of the county government in terms of education and ICT?
The functions of the county government.
Yours now, to get appointed. That would be the function.
The function was for the first will be administrative function, and the second will be implementation. Where you have to implement the governor's manifesto and the county assembly laws which will be passed.
So now we have problems right now. We have so many bodabodas who have dropped out from primary school. The because of hunger and poverty. Now they are border riders. So how will you assist this to educate them, or what will you do about that?
Okay, first of all, you need to know their needs. There are some who are not dropped out because of poverty or hunger, but for the urge of quick money. Most border riders like quick money, that they drop a person, get 100. So you need first to engage them and know their reason why they are on that track. Secondly, you need to talk to them and tell them that more about life. You know, life is not just getting money every day. There are days you don't get money. So you need to also know them. There are some who dropped out because of poverty, yes, as you say, and there are some who just are not interested in education, and I think that's the major problem in Kilifi. They're not interested. Yeah, the interest in education is very low. Because when I was doing my research, I saw that the literacy level in Kilifi is 52. Only 52% of people have gone up to primary level.
So now there are these ones who are finished class 8, who are interested in education, and they are still at home right now. So what would you do?
First of all is to sensitize and inform them of the available sources of funds they can get for them to go to school. Most people or head teachers should use that opportunity, like to, during the parents' meeting, to inform parents about the available bursaries and scholarships available, so that by the time someone is clearing primary school, they know where they can get assistance.
Like right now, they're already at home. How will you assist in this situation where this person, I think the calendar was in January, so they've been home since January until now.
If they're interested in going to school, yes, you are simply to find means and ways of going to school.
How will you reach these people?
How do I reach these people? Then it goes back to the MCAs in your ward. You need to know your people. When I saw the Maboka last time going door to door, fishing out people to go to school, he was going around with the MCAs and the area MPs. So it goes back to you again in your local, in your ward.
So can I teach them and bring them to you?
No, I don't operate a school. You need to find, so that's why I'm saying it goes back again to you. You know your ward, you know your people, you know their needs, you know why they are not in school. So take them to school. I've had cases of parents taking kids and dropping them at school, and they say, you're supposed to be in school, get into this school, register this kid. And the ward bursary comes back to you.
I think my fellow, you mentioned something about the bursary not being enough to sustain the whole community. So maybe as probably the education person, you find ways. If it's not enough, where else can we get it? So that we ensure there's 100% transition from primary to secondary school.
Yeah, there are so many, or a few that I know. First of all, there are so many banks which are offering scholarships. Then there are students and alumni who are sponsoring students, so many of them who are sponsoring students mostly from their school. So if people have been sent to that school, they just go to school and ask the head teacher who is not supposed to, cannot afford the school, and they pay the school fees. And then they are well wishers. Once raised in the social media, they do checking.
No, Clara, I'm talking about a school in that Hamid there or Tangatina. Who is our who will go there? If not you.
So there are so many well wishers in Shropshire. Once there and I found there's a leader community which is also sponsoring kids there. It's just that people are not informed. So the first thing is to inform through the head teachers, introduce to the parents that there is available scholarships being offered or sponsorship. Then the parents can launch the way forward.
Madam Chonga,
Yes.
we are very thankful the time you have ordered us
really appreciate the responses you have given. The committee now understands the type of person who has been nominated to that docket. There are very many questions, but because of time, we might not ask those questions. We believe that if the assembly reaches out to you for further responses to a number of concerns, you will give us the right responses, not like what you did before. And I believe if we give you we have given you an opportunity to make sure that on Friday at noon, you will facilitate us with the 2 certificates as shared. So allow me to give you an opportunity to give your final submissions.
I'll say thank you for the committee for this opportunity. Having been here to be vetted, education is one thing which I'm really passionate about, and I can see the statistics of education in Kilifi are quite on the lower side, although we are doing a little bit well because the literacy level in Kilifi is at 52% and the country literacy level is at 62. So it's something which we can push forward with your help, and I look forward that you will give me a tick in this docket.
Thank you very much. We wish you very well in your life. As you go by, pass our warm greetings to the great people of, is it Tazo? Yes, but they're saying you have not been engaging with them. Yes. So make sure that at least you visit the local school near you, so that you at least you can understand what is happening. Na wasalimie sana, waambie tuko hapa hapa. Sifanyia kazi wananchi. The committee will make their recommendations after have facilitated us with what you have told you. You have a good day.
Thank you.